네, 여러분 안녕하십니까?
Good morning, ladies and gentlemen. Welcome to 2025 International Symposium on Traditional Medicine. My name is Choi Jung-in. Thank you for joining us out of your busy schedule. I'd like to give a few housekeeping announcements before we begin. If you experience any health symptoms such as fever, cough, or chills, please ask our on-site staff members for assistance. Furthermore, please note that all food and beverages except for bottled water are prohibited within the venue. We appreciate your cooperation. The 2025 International Symposium on Traditional Medicine will do its best to ensure a safe and enjoyable event. We are providing simultaneous interpretation for this symposium. Please listen to Channel 1 for Korean and Channel 2 for English.
Providing simultaneous Korean-English interpretation, Channel 1 for Korean and Channel 2 for English.
Hosted by the Ministry of Health and Welfare and organized by the National Institute for Korean Medicine Development, this international symposium has been held annually since 2018. It has been leading the globalization of traditional medicine by discussing ways to expand the global market for traditional medicine with government officials and experts from around the world. AI is on everyone's lips nowadays, so this year's symposium, themed Korean Medicine Meets Artificial Intelligence, Pioneering a Future of the Traditional Medicine, will be held today and tomorrow. Today will begin with the opening ceremony, followed by sessions 1 and 2. Now, let me introduce the distinguished guests who have graced our event today. Please kindly stand and greet us when your name is called out. And also, members of the audience, please give a round of applause.
As your name is called, we kindly ask you to rise briefly and greet the audience.
We have Director General Jung Young-hoon, Korean Medicine Policy Bureau from the Ministry of Health and Welfare. Director Lee Eun-kyung of Policy Division, National Institute of Korean Medicine Development. President Lee Jin-yong of the Korea Institute of Oriental Medicine. President Yoon Sung-chan of the Association of Korean Medicine. And now let me introduce the speakers who will be leading the symposium. I will introduce overseas speakers first. First, Dr. Shin Soo-young, Chief Research Officer, Kakao Healthcare. Professor Sun Wian-dong at the Shanghai University of Traditional Chinese Medicine and Chair of ISTM 249. Professor Kim Yong-seok of Kyunghee University, Head of Delegate of ISTM 249. Professor Hwang Yi-chao at the School of Chinese Medicine, National Yangming Chiao Tung University, Taipei, Taiwan. Dr. Mira Abdallah Mohamed Al-Hamadi, Acting Division Director at the Department of Health, Abu Dhabi. Dr. Tekra Hassan Mohamed, Division Director for Drugs and Medical Products, Department of Health, Abu Dhabi. I would like to thank all the attendees and speakers for taking your valuable time. Please give another round of applause to the distinguished guests. And now, we will now have opening remarks to mark the start of the 2025 International Symposium. Today's opening remarks were prepared by Acting Director Lee Hwa-dong, but he was unable to attend in person due to unavoidable circumstances. Accordingly, Director Lee Eun-kyung of the Policy Division will deliver the opening remarks on his behalf. Please welcome with a big round of applause. Good morning. I am Lee Hwa-dong, Acting President of the National Institute for Korean Medicine Development. I'd like to express my sincere gratitude to everyone attending the 2025 International Symposium on Traditional Medicine, hosted by the Ministry of Health and Welfare and NICOM. I am delighted to be meeting experts from around the world. First, I'd like to express my sincere gratitude to Mr. Chung Young-hoon, Director General of Korean Medicine Policy of the Ministry of Health and Welfare, President Lee Jin-young, President Yoon Sung-chan, President Choi Do-young, and Chairperson Park Joo-min. We also extend a warm welcome to the traditional medicine experts from the United Arab Emirates, China, Japan, Germany, and Taiwan. The theme of this symposium is Korean Medicine Meets AI, Pioneering a New Future of the Traditional Medicine. This meaningful forum will explore ways to enhance the competitiveness of Korean medicine through its integration with AI. We will explore innovative strategies for traditional medicine utilizing AI and big data with the participation of domestic and international scientists and experts, including Shin Soo-young, Chief Research Officer at Kakao Healthcare. With the new professional qualification requirements for traditional medicine regulations in the UAE, establishing certification for Korean medicine practitioners, the presence of Korean medicine in the Middle East is expected to further expand. Dr. Mira Abdallah Mohammed Al-Hamadi and Dr. Tekra Hassan Mohammed from the Department of Health, Abu Dhabi, will kindly walk us through the details later on. This year, the WHO also announced the Traditional Medicine Strategy as a collaborating center for traditional, complementary, and integrative medicine. At WHO headquarters, NICOM contributed significantly to the development of this strategy. In line with this, we provided a platform to discuss the WHO's new strategy with relevant organizations and explore ways for Korean medicine to play a greater role in international health cooperation. As a leading professional organization in the scientific standardization and globalization of Korean medicine, NICOM will do its best to realize the value of Korean medicine. Once again, I deeply thank everyone who joined us. I wish you health and happiness. Thank you. Thank you very much for the opening remarks. That was Lee Hwa-dong, Acting President of NICOM, and the reading was done by Director Lee Eun-kyung. And now a congratulatory speech will be delivered by Chung Young-hoon, Director General of Korean Medicine Policy at the Ministry of Health and Welfare. Good morning. I am Chung Young-hoon from the Korean Ministry of Health and Welfare. First, I'd like to sincerely welcome all the domestic and international experts and delegates from various countries attending the 2025 International Symposium on Traditional Medicine. I'd like to thank Park Joo-min, the chair of the committee at the National Assembly, Professor Shan Wyan-dong, chair of ISO TC 249, Dr. Shin Soo-young from Kakao Healthcare, President Lee Jin-young of the Korea Institute of Oriental Medicine, President Yoon Sung-chan of the Association of Korean Medicine, and I'd like to thank all the experts who will be involved in presentations and discussions. Thank you very much for your contribution. I would also like to express my sincere gratitude to NICOM and other relevant organizations for your hard work in organizing this symposium. This symposium, themed Korean Medicine Meets AI, Pioneering a New Future of the Traditional Medicine, will be a meaningful opportunity to explore the future direction of traditional medicine in a rapidly changing industrial environment. In particular, innovation strategies incorporating cutting-edge information and communication technologies like AI and big data, establishing international standards and global cooperation, and strategies for expanding overseas markets will be key topics for enhancing the international competitiveness of traditional medicine. Today, over 500 leaders from academia, research, and industry from over 10 countries around the world have gathered for this symposium. This symposium will serve as a crucial turning point, sharing policy challenges to address the changing landscape of traditional medicine and developing a vision for global cooperation. Furthermore, we anticipate that discussions based on the experiences and cases of each country will open new horizons not only for innovation and market expansion of traditional medicine, but also for creating health value and international public health cooperation. Once again, I would like to thank everyone who took the time out of their busy schedule to attend. I hope this symposium will serve as a meaningful starting point. Thank you.
네, 고맙습니다. 정영훈
보건복지부장관의 하영사였습니다. 계속해서 축사.
So thank you very much. Next will be the congratulatory remarks for the 2025 International Symposium on Traditional Medicine. The member of the Korean National Assembly, Park Joo-min, and the head of the Committee of Health and Welfare will deliver his remarks by the video. Good morning, ladies and gentlemen. I sincerely congratulate you on the 2025 International Symposium on Traditional Medicine. This is the only international event in the field of traditional medicine hosted by the Ministry of Health and Welfare. I believe this event will spark crucial and important discussions among many participants about the transformations that traditional medicine can envision when adopted with artificial intelligence. I hope this discussion will lead to the advancement of traditional medicine to the next level, and would like to express my sincere gratitude to everyone who worked hard to prepare this symposium. Thank you very much. Thank you very much. That was the member of the National Assembly, Park Joo-min. Next will be delivered by President Lee Jin-young of Korean Institute of Oriental Medicine. Please give him a big round of applause to welcome him, everyone. So I can see some familiar faces. And this event has been taking place every year starting from 2018. So once again, thank you very much for showing your great interest in such international symposium on traditional medicine. The discussion we are going to make today will be under the theme of Korean medicine meets artificial intelligence, pioneering a new future of the traditional medicine. So today, in 2025 International Symposium on Traditional Medicine, I am very happy to be here together with you. It is a great honor to share the new possibilities to be created by the combination of traditional wisdom and cutting-edge science and technology such as AI. Traditional medicine is a precious legacy that has protected human health and well-being, and it plays a significant role in improving human healthcare today. We are opening a new future by combining this traditional medical heritage with cutting-edge technologies like AI and big data. The combination of traditional medicine and cutting-edge technology will be a crucial turning point, establishing traditional medicine as a leading force in future medical innovation based on scientific evidence. Global health and medical cooperation is no longer an option but a necessity. Korean medicine and traditional medicine must also open a new future based on international trust, international standards, and multidisciplinary collaboration. Cutting-edge technology and international cooperation will serve as a solid foundation for the sustainable growth of the traditional medicine industry and its entry into the global market. I hope that today's event will serve as an opportunity for researchers and experts in the healthcare field from around the world to pool their wisdom and strengthen cooperation. I hope that the discussions here will lead to improved health and quality of life for all people around the world. Finally, I would like to express my deepest gratitude to all of those who work hard to prepare for today's symposium. I wish everyone good health and prosperity. Thank you very much. Thank you very much. So along with the trend, Korean medicine should open a new future by adopting new technologies. So once again, thank you very much for such a wonderful congratulatory remarks. The next remarks will be delivered by the President of Association of Korean Medicine. So once again, please give him a very big round of applause.
안녕하십니까. 대한한의사협회 회장 윤성찬입니다.
Good morning, ladies and gentlemen. This is the President, Yoon Sung-chan, of the Association of Korean Medicine. First, I would like to sincerely congratulate the hosting of the 2025 International Symposium on Traditional Medicine. I would also like to extend my sincere gratitude to the Ministry of Health and Welfare, the National Institute for Korean Medicine Development, and also all the stakeholders who hosted and organized this event.
이번 심포지엄 주제인
I especially welcome the traditional medicine experts and distinguished guests from 20 countries around the world. The theme of this symposium, Korean Medicine Meets Artificial Intelligence, Pioneering a New Future of the Traditional Medicine, clearly outlines the direction of change and challenges that traditional medicine must face. Currently, artificial intelligence and big data technologies are already shifting the paradigm of modern medicine, and our efforts to integrate these technologies with traditional medicine will serve as a driving force for the advancement of Korean medicine and traditional medicine worldwide.
한의학과 세계 전통의학이 매우 빠른 속도로 성장하고 도약하는 중요한 계기가 될 것이라고
And I believe that this is going to serve as a very important opportunity to make fast advancement.
전문가 여러분께서 발표하고 소론해 주신
Furthermore, I am confident that the wisdom and experience presented and discussed by experts from various countries at this symposium will significantly contribute to future innovation and strategies, such as international standardization, research and development, and industrialization of traditional medicine using AI. The Association of Korean Medicine has also been committed to the advancement and globalization of Korean medicine. Based on clinical experience and academic research, we have maintained collaboration and communication with countries around the world. Going forward, our association, in collaboration with the Ministry of Health and Welfare and the National Institute for Korean Medicine Development, will contribute to the advancement of public health and global health care through the scientific and modernization of traditional medicine. We will further strengthen our solidarity with experts and institutions from around the world, ensuring that traditional medicine gains recognition for its value and credibility in the international community. As such, we pledge to dedicate ourselves to the globalization of Korean medicine. We sincerely hope that this symposium will serve as an opportunity for all attendees to engage in substantive cooperation toward the advancement of human health. We also anticipate that traditional medicine will be reborn as a universal value, contributing to the health of people worldwide rather than being the property of any specific nation. Furthermore, we hope that this event will go beyond mere academic exchange and become a meaningful opportunity to share the wisdom and experience of traditional medicine from each country, present a vision for the future together, and explore practical solutions. Once again, I offer my sincere congratulations on hosting this symposium, and I sincerely hope that everyone and their families will be blessed with health and happiness. Thank you very much. Yes, thank you very much. For the global advancement of Korean medicine, we listen to the congratulatory remarks from the President of the Association of Korean Medicine. And we also have a congratulatory remarks from the President of the Society of Korean Medicine, Choi Do-young. He could not make it for today's event, so you can find this message by accessing the QR code on the very back of your booklet. So from now on, I think this is going to be a great opportunity for all of us to take a group photo together. So we kindly ask all the honored guests and speakers to come up to the stage for the group photo session.
Speakers to please come up forward to the stage for a commemorative photo. 네, 앞쪽으로 자리해 주시면 감사하겠습니다. 네, 무대는 안 올라가셔도 될 것 같고요. 계단에 앞쪽에만 네, 서주시면 감사하겠습니다. 네, 한 3줄 정도로 나눠서 서주시면 좋을 것 같은데요. 네, 한 칸씩, 2칸씩 정도만 올라가서 서주시면 좋을 것 같습니다. 네, 무대 앞쪽에서 사진 촬영 진행하도록 하겠습니다. 네, 계단이 조금 협소한 관계로 다치시지 않게 조심해서 서주시면 좋을 것 같고요. 네, 앞쪽 바라보시고 사진 촬영 진행하겠습니다. 오늘 심포지엄 개최를 위해서 정말 많이 애써주신 분들이시죠. 네, 각 분야 전문가 분들께서 함께해 주신 덕분에 오늘 이렇게 귀한 자리가 마련이 된 것 같은데요. 저희 좀 좋은 사진을 위해서 손가락 하트 한번 해보시는 거 어떨까요? 네, 고맙습니다. 네, 조심히 이제 무대 아래쪽으로 내려가셔서 자리에 착석해 주시면 감사하겠습니다. 대단히 고맙습니다. 네, 잠시 후 저 축하
So now the congratulatory performance will be ready shortly. We will take a moment to clean up the stage to prepare for the performance.
네, 오늘 포럼은 전통 한의학의 가치와
Today's forum will be emphasizing about the new possibility and potential and the new future of Korean medicine. So for a very long time, we have gathered quite a lot of wisdom that will be adopted with science. And just like that, when it comes to culture, we need to have some combination or harmonization. So in such a stage, we will have a very beautiful stage prepared by Team Bidan. Today's performance will be done by the Fusion Korean traditional music group Bidan, comprised of vocals and Kayagum, Taegum, and Haegum. The group presents a wide range of performances encompassing not only original compositions but also K-pop. So please give them a big round of applause, everyone.
Thank you very much for the beautiful performance. That was Bidan, who performed a wonderful stage. Thank you.
네, 고맙습니다.
Thank you very much.
주제로 한 창작곡부터
So they played various songs, including the ones regarding traditional medicine, and also K-pop songs. That was Bidan once again. It was a beautiful combination of tradition and modern music, just like the as we are envisioning the future for traditional medicine. So I felt like it was very in line with our efforts to combine the traditional wisdom and new technologies. Thank you again for the beautiful and meaningful performance.
네, 이제 본격적으로
And now let us proceed with the symposium. First is a special lecture which will be given by Dr. Shin Soo-yong from Kakao Healthcare, who will be speaking about making people healthy with technology, Kakao Healthcare's way. Please welcome Dr. Shin with a big hand. Good morning. My name is Shin Soo-yong. I am from Kakao Healthcare.
I'm speaking in Korean because lots of the audience is Korean, so sorry for the foreigners. So you better use the interpreter services. Because I'm Korean, I'm much better speaking in Korean. 예, 갑자기 앞에 공연 이런 걸 하고 저보고 발표를
So that was the performance, and I am the next. So it's a little bit nervous because you just saw BTS, and now I am up here. Thank you very much for this opportunity to speak to you today. I am working for Kakao Healthcare, and I will be speaking about combination of AI and big data with the traditional medicine. So this is going to be something introductory. So the title is to make people healthy with technology. That's the mission statement of Kakao Healthcare. So Kakao Healthcare is something familiar to Koreans, but I will introduce our company briefly first, and then I will introduce our data platform, how we standardize the data, and how we use LLMs and generative AI in that process. So this might be a little different from what you thought, because Kakao Healthcare is not a device manufacturer. We don't manufacture devices for medical purposes. No, we deal with big data and the standardization of big data and utilization of the standardized data. So we are doing platform for that, and that is what I'm going to focus on in my presentation. So you are familiar with these terms. So so-called AIMD, including the structuring and preparation of data, utilizing existing data is more important in my opinion, so I will be speaking about that too. This is our company, as you all know. This is a slide that I bring to speak to overseas audience frequently. So many of you use Naver, but I admit that they are quite convenient, but surprisingly, Kakao provides everything for you to get by a day, to live for a day. You call a taxi using Kakao T, and you watch webtoons or novels using Kakao webtoon services, and you pay for lunch with Kakao Pay. And gift giving is also another feature. It's very common in Korea to give gifts through Kakao, so individual chats or group chats. And you can also find a restaurant and reserve a restaurant, and you can listen to music through Melon. And you are also using Kakao Bank and also play games. So these are the activities you can do using Kakao services. A lot of Koreans are doing this. So we are creating many services, but Kakao Healthcare is a fully owned subsidiary and specializing in healthcare sector. So as you can see, Kakao started with Kakao Talk, it's an instant messaging service. 95% of Koreans are using it. So it's a very absolute penetration rate. It's like Line in Japan. And we also provide mobility service. You can call a taxi. Many people use Kakao T for calling a taxi. So this is the mobility service that we provide. And when it comes to internet banking, Kakao Bank, we have Kakao Bank. It's number one when it comes to mobile banking. So we are competing with Neighbor series, but there's a webtoon service Picoma in Japan, and not many of you know that Picoma is a part of Kakao Group. It's a number one webtoon platform in Japan, and it's a subsidiary of Kakao Group. And we also purchased SM and Kakao Entertainment. So we are doing these various things, and we are providing services that are very close to everyday life, including healthcare. So that is why you are gathering here at this forum. In March 2022, we established Kakao Healthcare. We are 4 years into our journey. It's a 100% owned subsidiary by Kakao Group. We think we are a startup, but we are classified as a large conglomerate. We are often compared to Naver Healthcare. Kakao Healthcare is a independent company, whereas Naver is a research center under Naver. So they are not an independent enterprise. So the difference is how actively doing business. So our mission is to make people healthy with technology to achieve, and we have people working towards this mission. And our vision is data-driven, AI-enabled healthcare company for digital phenotyping and precision healthcare. You all know what data-driven means, and AI also. Digital phenotyping, I don't know how many of you know this notion. It's a medical term. There's a genotype, and phenotyping is the counterpart of genotyping when it comes to diseases and symptoms. It involves blood tests and CT, MRI, and medical testing. Very costly, but recently, with wearable devices and mobile apps, we can use the data on apps for phenotyping purposes. So that's kind of the concept of phenotyping. So through digital phenotyping, we do precision healthcare. So that is our vision. There are many solutions that we provide, including PASTA, the mobile chronic disease management platform. And today I will speak about HRS, Hey and Heycorn, which are data platform. About HRS first. Why we do data healthcare data platform business? There are many other companies in this field. In other countries and in Korea, many startups are doing this. But why are we doing this? Tempus AI is very famous, Nasdaq listed company in the US. And what they do is what looks like this. The healthcare market will grow about 24% annually. By 2029, the market will become huge. As you can see, the $133 billion. The market will amount to $133 billion. It's a very big market. And the services, various services will be needed to get there. And the reasons driving this market expansion is AI, but more fundamentally is EHR, electronic healthcare record, are being actively adopted, and healthcare institutions are digitizing their data more competitively. When it comes to traditional medicine, traditional medical institutions are also using EMR, so I think you are very prepared to adopt this kind of technology. The problem is many companies are there in the market, but what differentiates Kakao Healthcare? That is, we provide comprehensive healthcare data analytics service. So from the beginning to the end, we provide a one-stop service from data collection to data utilization. In more detail, recently, if you want to publish a paper in a journal, no matter how much AI you use, you need to do research first. That's a fact. So as a single institution, no matter how much you do the research, and the papers are likely to be rejected by the editors, so research should be very lengthy. Aside from IRB, if you pass all the administrative processes, most of the data that I need, that you need, is in the text. The consultation history or test results of patients, it's not coded, it's not structured in codes or numbers, but they exist in the form of narrative texts. So you need to extract relevant data from the unstructured data. So you employ researchers to do the research work, and you make junior staff to do the job. So it's very time consuming, and different codes are used by different medical institutions. Different hospitals have to deal with different severity of diseases of patients. So in the primary clinic, maybe the level of rigor in medical treatment can be lower than tertiary hospitals. So having said that, standardizing local codes is necessary, and privacy issues, because you're dealing with narrative texts and there are personal information there, so you need to think about the privacy issues as well in the stage of preparing the data. And when it comes to data analysis, you have the data and you find out that you have this big chunk of text and it's not ready for input in the AI. So pre-processing is necessary, and it's a very tedious manual work. It's all proven in the literature. About 90% of the time goes to data processing. The analysis itself can be done in a very short time. So pre-processing takes a lot of time, so there are many pain points there. And you want to do this data analysis and IRB issues, and the hospitals are not able to upload the data to the clouds. They say you come to the hospital and analyze the data here, and you take the data out with you. So it's I don't know, it's kind of a Korean situation. So with LLM and Gen AI, GPU server is very critical, but hospitals in Korea don't have that kind of GPU server, aside from big hospitals. I think the situation is similar in other countries. And cloud also takes costs. So researchers and hospitals have the burden for that, and it drives up the cost of research. And GPU A100, we benefited from a discount, but still it costed 10 billion won. So it's a very costly process. And with the privacy issues and everything, it's very critical to resolve these pain points first. So we focus on preparation of data, so researchers can only focus on the analysis. So that was kind of the starting point for Kakao Healthcare. So we needed two things: hospitals, the medical institutions with the data, and also the demand institutions who needs the data. So there's a research alliance that involved hospitals in the network, so that they can have the standardized data. And in the Innovation Alliance, it's a group of institutions who need to use the data. It can be a pharmaceutical company or just general company or a tourism company even. So we provide the data to these institutions. As you can see on the slide, there are 17 hospitals participating in the alliance in Korea. And Kyunghee University Korean Medicine Hospital is participating, and they are using our service. So we aggregate the data from these 17 hospitals. It covers 17,000 beds, and annual patient number stands at 25 million. It's about half of the total Korean population. So there can be overlap when it comes to headcount, because we think that there are many overlaps, but anyway, we think that we are covering about half of the entire population. And APEC, we are collaborating with APEC and Middle East and North America. We are tapping those markets. So I will speak about these later on. And what we install in these hospitals is, the names might be different in the future. It's called HRS, Healthcare Data Suite, Research Data Suite. So that is what we are installing in these hospitals. It's a kind of a data warehouse system. What are the benefits of this system is they have the same platform, they share the same platform, and we do the installation. So we standardize all the data. So the hospitals will have a data warehouse, and you extract data from your platform and from another platform. But since these 17 hospitals share the same platform, if you let the another hospital know, then you can integrate the data between your institution and another medical institution. That is one of the benefits of our system, to help you understand better. So there's a HRS platform that we install in hospital, and you always ask that are you trying to take away the data? But that's a complete misunderstanding, because we cannot and we should not do that. As I mentioned before, I am also responsible for privacy protection, so I would not face the risk of jail term. So I will never do that. Before I came to this company, I worked in hospital for a dozen years, so I am very well aware of the situation. So we install the system in the hospital, and the system belongs to the hospital entirely. The management is done by the hospital. We do the installation, but to access the system, we need the approval to access the system as an external body. So that's the very rigorous system for protecting personal information. So you go on the platform, there's a UDM data model, common data model. The data will be processed and standardized. So all data will be in the same format. So on a single button click, you will be able to use the data item. That's the one very different thing from other systems. I have a video to show you. Let me try and play it. So you're doing the search on the left, the diagnosis name, ICD code. You're doing the search with the code, and the data is extracted. It's a quite simple process. But the important thing is the number of patients is very important. So we focus on showing the number. And the next one, it looks like a more complicated search. So search condition here is more complicated, drug name and test name. So it's shown in a flowchart format. So it shows the changes of patient number, and if you can go back to the previous step and relax the condition a little bit or add another criteria. So basic statistical analysis is given, the number of male or female patients and the number of patients who took the test. And if you're satisfied with the data, then you can proceed with this data for your research. And this one, basically within this tool, you do AI, machine learning, and deep learning. Were not realized because of the cost issues, but basic machine learning features are included. So most of the data are available here. If you are trying to write a paper, then you will need more than just basic data. Then you can download the data in the Jupyter Notebook. So you open the Jupyter Notebook to do the analysis. You run the LLM or anything you want to use the data.
So the other core of our part is the issue regarding protection of privacy information. So this is what we use, privacy information technology. So recently, we have the concept or notion called PT, but it's something that has been under research for the past 2 to 3 decades. So regarding these notions, so whenever we have those data, if you take a look at the documents, sometimes they're included, sometimes they're not. So everything should be detected. So that solution will be created by us to come up with the filtering and de-identifications. So not only we are doing the researches or searchings, but also the people from the medical institutes will be validating everything to make sure that everything is fully satisfactory. And one more thing is that whenever we analyze data, we run a methodology called federated learning. So what is federated learning? So whenever we try to come up with machine learning or deep learning, we have to compile all the information in the center. That's what we prefer. However, if we compile all the information in the center, it will be very vulnerable to the attacks from the hackers. And then that can always have higher possibility leading to privacy information attack. So that is why we don't like the fact whenever the hospital try to store their data outside, because once the data is stored outside, it can lead to privacy leakage and the hospitals are going to take responsibility, and that is why we don't want those issues to be happening. We become very reluctant. So that is why we try to use a solution called federated learning. So what is federated learning? So not storing data outside, well, learning will be done inside the hospital. So let me put it easy. It's not like machine learning, but let's try to think of analyzing statistics. We try to come up with deviations and average numbers. So we have a lot of different numbers or a lot of different hospitals. So we can come up with deviations and averages. But rather than that, we try to calculate the different averages and deviations from each of the hospitals and then try to combine or compile all those numbers and then try to calculate the average or deviations. So that's a difference. So that is a basic notion of federated learning. So what we do in AI is once we exchange the parameters that have been trained, then we only update the weight and then we try to train them and locals and then we go through a repeated process of exchanges. So that will come up with the same result as centralized analysis. So we already have a lot of documents and papers outside that's done a lot of research about this topic. So the information about the patients will not be stored outside. That's the point. So we collaborated together with Google. So this has been introduced quite a lot in Google events as well. And for this, we created a new portal called Haycorn. What is this? So since we are operating a company, we want to collaborate with a lot of companies or medical institutes so that we can utilize those data. For example, let's say we have 7 medical institutes. Rather than saying that, we try to come up with a Haycorn. So what is this? It's a portal with different catalogs. So all those basic information, such as how many patients they are, what their diseases are, those kind of information will be put in portal. So once you become a member of this portal, you can have an idea about which hospital you should contact to get the information. It will be much more easier. So the reason we're providing such services is because by doing so, we can reduce the burden about all those services. So all you need to invest is time. So that's all you need to invest. In RW study, well, we know there are quite a lot of post-market surveys done by pharmaceutical companies. It takes approximately 18 to 24 months. But theoretically, everything can be analyzed in just 8.5 months just to get the same result. And that is why a lot of multinational companies want to work with us, multinational pharmaceutical companies. So whenever you create such services, well, this is going to be the main for my presentation. How are we going to standardize the data? So this is how we do the data curation. As you can see from the images, a lot of medical institutes have their own data, but what we need is what you can see from the image. So this will be acting on behalf of the data curation. So what we try to utilize is UDM, Universal Data Model. So this is something defined internally by us. So some of you might have heard OMOP CDM. So this is like a post-market surveillance data model. But for us, all those research medical institute data will be covered by 100%. So in order to create this, we refer to a lot of different models. And since we have to standardize all those different data, since a lot of medical institutes are using their local data, we try to standardize them. So all those data are compliant with international standardized codes before being provided, so you can use them right away. So do you have to know about all those different codes? Not necessarily, because you can research the codes that you are familiar with, and then since everything is already mapped, you can just do the searching. So it's not going to be a burden at all for you to export or extract any data. So let me show you a video for a while. So I wanted to show you a video about the process of our data standardization. So I'm not sure why the sound is not working. So I'll try to explain instead. So at first, we had a person. I know we have a slide later on, but for example, let's say doctors and nurses were doing all those laborious or tedious work.
Healthcare uses AI vector similarity scores and improve continuously based on results. Our tool leverages AI to translate terms. It's user-friendly, validates new concepts, and prevents duplication for data quality. Users can select the best matched concept proposed by auto-mapping, or choose to map to a different concept. For SNOMED CT, users can create detailed new concepts and instantly review them in the browser. As for now, over 1.19 million terms standardized with 27,000 new concepts. Terminology has been unified at 17 institutions, and continuous updates allow HRS to drive robust multi-center research. With Kakao Healthcare, terminology standardization becomes a breakthrough for innovation.
그래서 지금까지 진행을 했던
So if you take a look at what we've been doing up till now, the ones that you first saw are our ultimate goals. So all those hospitals' data have all been mapped, and we have worked on them. So the necessary things have been mapped with RSSFD as well. So that is what we have done. And you can see the mascot of our hospital, of our company. So why did I put that up there? It's actually a Kakao character called Lion. Now you can see that it's wearing the doctor's gown. It's actually accredited from the SNOMED, so we have been authorized. So a lot of companies have been authorized around the world. So we have the authority to create new codes. So we have created approximately like 27,000 codes, and we are providing them. So the story is very long, but if you don't go through that process, if you don't have that codes, you will have to combine all those existing codes and end up having very, very long codes. And it will be very difficult to do any searching. That is why we try to adopt code so that you can do your searching much more easily. Things will be much more easier. So then how do we utilize AI? As mentioned earlier, a lot of companies adopted with digital. Well, they come up with something like CDSS, but for us, it's not CDSS. We try to improve productability by utilizing AI. So I think I mentioned about it earlier, but when we standardize all those data, what did we do up till now? Everything was done by human being, by manual work. So some of you, if you've been out on the field, I think you know about it. It's a very labor-intensive work, requires a lot of handwork. And you don't feel very rewarded. You feel like you're just being exhausted, wasted. So I know that a lot of smart people are out there, but for example, if a doctor is doing this, it wouldn't make sense. It would be much better to try to automate them. So with a large language model, I think I talked about it with a video, but we try to come up with a solution for automatic mapping. And as mentioned earlier, it will save your time dramatically, and the accuracy will be improving from 85% to 90%, and time will be saved by 30%. And new concept authoring will be 70% reduced, and efficient mapping and concept validation will be reducing time 30%, and speedy data post-processing will be reducing time by 10%. Well, so now all we need is, for example, like 7 man-months. So a lot of cost and time saving can be achieved. So these were already shown with the video earlier. And most of the medical institutes, well, their EMR data will be indicated in text. So if you take a look at the text, you can see a lot of crucial important data. For example, if you go to the pathology division, you can see all those diagnosis information, but everything is done on text data, so you have to analyze everything. So for example, if you go through CT or MRI, everything is written narratively in text format, but we try to convert them into data format. And in order to do all those tracking, we utilize LLM and try to come up with solutions. So without using LLM in the past, people took a look at the data and converted those data all by one. So now things became a little easier.
Uses AI-powered technology to structure massive amounts of unstructured medical data. This unlocks its full potential, enabling personalized precision medicine. Medical professionals are defined entity names and values. This allows for accurate and clinically relevant annotation. Validated for accuracy, these structured results support high-quality AI model development. AI model are fine-tuned for medical data and optimized, using automated evaluation systems to achieve high performance with minimal data. Optimized models can structure over 80,000 records daily. This enables wide application of medical data. On Kakao Healthcare's HRS, researchers can select structured data when building cohorts to streamline research and improve quality. In the Precision Medicine Knowledge Bank solution, AI model performed the initial structuring of complex genome.
So I know it was fast, but all the data on the paper has been converted into data so that you can do the searching very easy. So export or extracting will be very easy. So in the past, you had to analyze all the data, but now everything will be much more easier. And you can see the number for the accuracy. Regarding accuracy, we always try to keep it at least above 90%. So it's not precision, we call it F1 score. Again, they should be at least above 90%. So what does F1 mean? If you know what F1 means, you know that this is a very amazing number. But regarding medical numbers, if you don't have at least 90%, nobody will trust you. You will be reliable to nobody. So that is why we try to keep it at least 90%. Except for exceptional cases. So in the past, when we used to do with manual work, we used to try things with machine learning. But back then, it took more than 4 months for 10 documents, but now it doesn't even take 1 month for 200 documents. So things became much more efficient. We're still working on it. So that was my presentation. So my message, once again, so if you want to utilize AI, there are quite a lot of different things to think about. Well, a lot of people say that AI requires data. However, what about refining those data? That's something that nobody pays attention to. So for Korean medicine, if you want to adopt AI actively, well, somebody will have to take responsibility to standardize them and go through the pre-processing to refine those data before analyzing them. That's something that you need to invest in. And after then, whether it's the medical companies or the researchers, you can get the outcome that you want. So AI itself is not the goal, but once you come up with the required foundations or the basic parts, everything will be much more easier. So please make sure to focus on that part. And that is why we have come up with the data platform so that we can go through pre-processing and standardizing them. I know it takes a lot of time and energy. Well, we've been working for the past 3 years and installed them in total 17 medical companies. So then how did we earn money? No, we didn't. We only invested money. So yes, we are a subsidiary of KakaoTalk, and that is why things were possible, because we already had quite a lot of capital. So once again, you need to have a very long-term perspective. That is the end of my presentation. Thank you for your attention.
네, 고맙습니다. 데이터
Yes, thank you very much. So you were talking about how you can increase your precision and accuracy based on data-driven services. So by utilizing AI and big data, maybe we can further advance our Korean medicine one step further. So once again, thank you very much for the special presentation. Please give him a big round of applause, everyone. So that was all for the morning session for today. So from now on, we are going to have lunch. I believe you received a voucher for lunch when you were making registration this morning. So from the voucher, you can see 5 restaurants that are available for the voucher. So I kindly ask for your understanding that we had very limited number of vouchers. So we are going to resume our session 1 and session 2 starting from exactly 1:30. So enjoy your lunch and I will see you again here exactly at 1:30. Please be seated before 1:30. Thank you very much, everyone.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the Clinical Data Big Data Hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology. Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices. And the clinical data big data hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. we conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development. What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the clinical data big data hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
For our healthy lives, Korean medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology. Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices. And the clinical data big data hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. we are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development. What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean Medicine Clinical Practice Guidelines for safer and more scientific medical practices, and the Clinical Data Big Data Hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers. as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
For our healthy lives, Korean medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology. Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean Medicine Clinical Practice Guidelines for safer and more scientific medical practices. And the Clinical Data Big Data Hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development. What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the clinical data big data hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
For our healthy lives, Korean medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology. Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the clinical data big data hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. we're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development. What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean Medicine Clinical Practice Guidelines for safer and more scientific medical practices, and the Clinical Data Big Data Hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry. is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
For our healthy lives, Korean medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology. Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean Medicine Clinical Practice Guidelines for safer and more scientific medical practices. And the Clinical Data Big Data Hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development. What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the clinical data big data hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
For our healthy lives, Korean medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology. Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices. And the clinical data big data hub for smarter and more professional resources are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes, with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development. What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the clinical data big data hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods. and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
For our healthy lives, Korean medicine is on the journey of finding solutions from nature and realizing them through science. Korean medicine has now evolved to go beyond Korea to heal the world, to provide the key health solution for the humanity. Korean medicine not only treats the human body with ingredients of nature, but also applies the wisdom of nature as the basic principle of medicine. Korean medicine finds solutions from nature to open the future of humanity's health. The nature-friendly value of Korean medicine is taking a lead beyond treatment to heal the people with future medicine. Korean medicine, with 5,000 years of history, is the key to the healthy lives of Koreans. The long history of Korean medicine is making a new path for the innovation of future medicine and the humanity's health. The wisdom of time carried by Korean medicine does not stay in the past or present. The infinite potentials found in the tradition and history of Korean medicine are expanding day by day. Korean medicine is evolving to the new future of medicine. It realizes the future of medicine by integrating the values of traditional medicine with the cutting-edge technology in modern science. The quality and safety of Korean medicine treatments are giving hope to the people around the world. Korean medicine focuses on people. Korean medicine pursues natural health. Korean medicine is taking the lead to take care of the health of humanity. Korean medicine continues to build trust in many ways. Korean medicine continues to develop through the integration with modern science. Korean medicine leads precision medicine by combining with information and communications technology Korean medicine is evolving to the future of medicine for people of the world.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean medicine clinical practice guidelines for safer and more scientific medical practices, and the clinical data big data hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal herbal ingredients, providing new treatments for infectious and chronic diseases using sound theories and accumulated clinical expertise. Korean medicine, the forerunner of personalized medical care and a true leader of the future medical industry, is opening a new healthcare paradigm with an evidence-based system that everyone can trust. Korean medicine is rooted in Korea, but its future is out in the world. We're constantly growing our network of support and cooperation to meet global standards. By providing the best medical care to patients from overseas, and education and research opportunities for students and medical service providers, as well as Korean cultural medical contents to more and more people around the world. We are now at the center of K-Medi and life care, going beyond healthcare. We are gaining the attention of the whole world by raising the brand value of Korean medicine in the traditional medicine sector. We are working with local and global citizens to create a sustainable future for the healthcare industry. National Institute for Korean Medicine Development.
Get down to business.
What will the future of Korean medicine look like? It will be a world of diagnoses made using AI and big data, and personalized precision medical services. Korean medicine is changing beyond our expectations and imagination. Korean medicine, with clinical information systematically accumulated over 5,000 years, transforms the future of the medical pharmaceutical industry. We are leading these changes and innovations and raising the value of Korean medicine. Our work begins with the scientific clarification and standardization of Korean medicine. Through this, we are building public trust in Korean medicine and realizing its innovative industrialization. How can we improve the safety and quality of Korean medicine? What policies are needed to bring Korean medicine closer to the people? What are the possibilities and potential of Korean medicine throughout the world? As the nation's only agency that promotes Korean medicine, we are constantly looking for innovative solutions by integrating tradition with cutting-edge technology. Korean Medicine Clinical Practice Guidelines for safer and more scientific medical practices, and the Clinical Data Big Data Hub for smarter and more professional resources, are strengthening the pulse of innovation in Korean medicine, which has thrived for over 5,000 years. We conduct in-depth studies to raise the value of Korean medicine. We develop both new and original therapeutic technologies based on scientific principles and methods, and find greater possibilities by demonstrating the safety and effectiveness of Korean medicine. Every research we do challenges us to take the initiative in the future medicine market, and is part of our journey to build a new industrial innovation ecosystem. We support product development by companies and research institutes with effective medicinal.
네, 여러분 식사 맛있게 하셨을까요? 네, 그러면 2025 전통의학 국제 심포지엄 오후 프로그램 이어가 보도록 하겠습니다.
Session of 2025 ISTM. We will have a session 1, where we will discuss AI and big data and strategies for traditional medicine. The first presentation will be given by Professor Seo Byung-kwan on the topic of standardization of traditional Korean medicine terminology and big data strategy for ensuring interoperability in healthcare data systems. Professor Seo is a professor of Gyeonghee University. Please welcome Professor Seo with a big hand. So I'm the first speaker in the afternoon. So I guess you might be a little sleepy, and interoperability is not the most exciting topic. So personally, the term standardization, I don't like the term very much because it requires additional procedures. It should be a basis where we can continue our discussion going forward. So we're talking about AI today, and the term AI might be a little repulsive to many of us. But I am working on AI and publishing papers continuously on AI. So in order to apply AI in Korean medicine, I am having a lot of thoughts. Dr. Shin in the morning session answered this question already in a way. He basically said everything that I wanted to say. So in my presentation, I will introduce what our institution has been doing in this regard. This is a picture. What comes to your mind seeing this picture? It looks cool, but it can also feel quite outdated. So this is what tradition means, perhaps. And also, this can be the perception towards the traditional medicine among the public. So we need AI or AI-based modernization in a way. Personally, my area of focus is non-reactive symptom regarding tissue damage. So how to treat incurable diseases is my area of research interest. So I conducted in vivo studies, and I conducted RGT, and it sometimes fails. It is very costly. And the outcome is not always good. In the clinical field, we need data. The treatment options are so various, so diverse. There are so many situations, different situations. So extracting data from those situations, there's a lot of room for misunderstanding. So how to control those areas is a problem, but it can also be a starting point. So when we use healthcare big data, we collect data first, and then we process them, and we analyze them, and we make it visible to utilize it. The pre-processing takes about 90% of time, but I think that it's even higher than that. So I was writing this paper with the data from HIRA, and it took about 1.5 years for me to pre-process the data. So pre-processing is very difficult because it is difficult to locate the data, the exact data that we want, and we sometimes have to create the data that we need. So there is a diagnosis and treatment information and frequency data and lab data, imaging data. So it is a bit easier to analyze big data in conventional medicine, but when it comes to Korean medicine, the data and information have to be labeled at each time. And it can differ from the way of education, depending on the ways of education and the timing of education. So depth of information itself is varied. It's not consistent. That is the problem. So pros and cons of traditional medicine. One of the pros is that it is customized, meaning two things. It's not mass produced. Korean medicine is not something mass produced. So in translational research, we do retrospective and everything, but in reality, it's really difficult to get the data. It's not standardized. Whether it is diagnosis, intervention, or evaluation, those are not standardized, and data quality is not consistent. When we have a patient, we ask them questions and we write down all their statements, and when we treat them, we do the acupuncture and different options. But so the conversation we had with the patient is quite meaningful from that stage. So when we are talking about interoperability, it is mainly about how to communicate with one another. So whether writing a paper or talking to a patient or collaborating with a researcher, we have to speak the same language, but we are not doing that. That is the core issue. Forcing something onto others is not standardization because we come from different backgrounds. So to resolve these issues, we look to AI, and there seems to be some guidelines and papers, traceability, usability, robustness, explainability, things that we can understand on a common ground. And we will look at a CPG. The project these days is based on CPGs. So we don't have standardized database. So we gathered the information systems, existing information systems. There is this symptom, the back pain and leg pain, and there are major pieces of information here, and we do diagnosis. And if there is a red flags, then testing will follow. If positive, then the treatment differs depending on the test results. And we do physical examination, and then we test and diagnose. And after that, the diagnosis will be confirmed, and the intervention will be conducted. But before that, there is something called syndrome differentiation or identification. Here we understand, we question whether this patient is coming because of a symptom or because of a disease, and we have this differentiation model and treatment model based on the result and how to process all that data. So this project is sponsored by Ministry of Health and Welfare. It started 2021 into present date. There are various things, but simply put, so we are coming up with standardization tools, and before that we create this content. So framework, standardization, dissemination, and connection are the major pillars of the project. So to do this, we collaborated with these institutions, including 12 university hospitals and Korean medicine EMR groups at Korean medicine clinics, the producers. And we have FIRE as an information exchange standard, and SNOMED. We use SNOMED as a terminology standard. So we have different working groups. As you know, terminology is based on SNOMED CT and ISO. And the terminology defined by Association of Korean Medicine, we also fire an ICD, KCD, and KEMHE. So these are the guidelines that we follow to make content. So this is a core data model. So 4 main areas. So the additional data, if you look at the additional data, pattern diagnosis, photo information system and intervention, and medicine, the prescription and functional tests. So information from the patient, it is input in the machine and it is added to the table for that to work. So we are doing that side by side with the other things. So from 2021, we use CPG to collect this data. And CPG is an overview of the disease, what kind of needles is used. All those information is contained here, and we collect all those information, and then we analyze the data to make a data set and to build a data model and EMR model. So when we did this, we did not do it on our own. We worked with other experts through the consensus with other experts from outside organizations. So we did the analysis, and then we mapped it through FIRE and conceptual, logical, physical modeling, and we made this framework. It looks like EMR. It looks like a EMR project. Some people might misunderstand, but that is not the case. So we gather all the CPG data. And so we gather this data and we separate them into 16 categories. And we extract CPG components. And then we match them into with different types of EMR. Then CPG does not cover all diseases. So in reality, we collaborated 2 hospitals and 1 clinic, and we recombined the data entirely. So data flow is practically important, and we designed it ERD. Based on ERD, it can be heavy or light. It will be easier to retrieve data later on. So this is the way we design the data. And if you look at it, you extract something, and there's the basic terminology. Pain in the knee or heavy knee. Those are all different expressions of knee pain. So we did the labeling. And to verify the labeling, we got the verification from the academic society. And there were some possibilities and impossibilities in the verification process. For example, the prescription is not within SNOMED. The herb name is not also not included, and all other treatment options are not contained. But there are similar terms. Then how to process that? So we worked on that. So we worked with ontology expert. So to distinguish between conventional and traditional, to find out similarities and dissimilarities about conventional medicine and Korean medicine in the mapping process. There is an EMR certification system, and these certification elements, we we checked whether the elements are included in building our database. And if you look at this diagram, it's quite simple. On the right is prescription, and on the left is intervention. So there's different levels of categorization. When it comes to medicinal herbs, the names of prescription should be identified. The problem is the same prescription can have different meanings. So you attach the reference at the back. So efficacy and formula forms another category. But the purpose can be different, and you can add that information at the end. So through this work, we implemented education program. So we wonder whether this can be applied to medical institutions. So the project has been going on for 3 years now. First was done with Korean medicine clinics, and they said it's difficult, it's hard, but their response was overall positive. In Korean medical clinics, they have this pre-existing database, and then they added our feature, and it was even better, they said. And on this slide is kind of the point of my presentation. When it comes to RWD is coming out to the world thanks to the effort of the physicians and all other people who are generating data and data gatherers. And in order to avoid garbage in and garbage out, we have to cut data in the right way when we first generate the data. Of course, we can process it with LLM, but even so, the minimal work needs to be done beforehand. So our system is kind of the tool for doing that. And the most important thing is differentiation of symptoms and judgment about symptoms by the physicians, and the systematic standardization of herbal medicine and prescription. So data will build more and more. So the National Cancer Center has basically the same model, is working on the basically same model. And we need to ensure interoperability for different hospitals to work together. And the ways of KRC-DA securing is also being addressed. So the data can be within one framework, so everyone can view and use it. More details, I hope I will have another opportunity to speak to you about. And after the project is completed, and the tentative version will be provided late this year or early next year. So that was my presentation. Thank you.
네, 고맙습니다. 보건의료 데이터 상호 운용성 확보를 위한
한의학 용어 표준화뿐만 아니라
That was
자세하게 설명을 해주셨는데요.
so the speaker talked about standardization and interoperability of medical EMR in KM.
두 번째 발표는
So let's move on to the second data.
어떻게 바꾸는가라는 주제인데요. The
The title of the second data is going to be From Anecdote to Algorithm, How AI and Big Data Are Shaping the Future of Traditional Japanese Medicine, which will be carried out by Tetsuhiro Yoshino from Japan, Keio University School of Medicine.
주셔서 감사합니다. Good afternoon, everyone. My name is Tetsuhiro Yoshino from Keio University School of Medicine in Japan. All right, maybe some of you have to wear the translation machine. I know the English translation was quite good, so the Korean translation should be very good. So please prepare for your ear. Thank you. So today I am very excited to talk about our research titled From Anecdote to Algorithm, how AI and big data are shaping the future of traditional Japanese medicine. And actually, traditional Japanese medicine is pronounced in Kampo in Japan. And actually, when we say Kampo, it sounds like Hanban in Korean. And so it's very confusing. But my campo is Japanese medicine, Japanese style medicine. So please note about that. All right. So first, let me briefly introduce myself. Maybe most of you do not know myself and the unique framework of the Japanese medical system. Thank you. Thank you. So in Japan, there is only one type of medical license for physicians. So we physicians all study conventional biomedicine in medical school. And for example, I graduated medical school in 2008, and I first trained as an internist and board certified as an internist in 2011, and finished advanced training about internal medicine in 2015. And after that, I choose to subspecialize in Kampo medicine, traditional medicine. And this is the standard path for becoming a traditional medicine specialist in Japan. And it is also important to note that acupuncture and massage and moxibustion are under a different licensure. So legally we can do that, but usually we are not trained about doing acupuncture, moxibustion, or massage or things like that. And my main research interest is using a real-world data to create a clinical decision support system for Kampo medicine, and especially for traditional herbal medicines and traditional herbal preparations. And I'm also working with other two, but they are not for today's my talk. But I am also working with, a genetic background of cold temperature hypersensitivity and licorice-induced pseudo-hyperaldosteronism. And on a personal note, I love my family, and I am a big fan of Korean food, including, Korean barbecue, kimchi, makgeolli, jinro, chamisu, or things like that. All of them are very popular in Japan, and I'm so happy to be here. In Korea, Lotte, I don't have to mention about it, all right? And okay, so now let's move to the main topic of Kampo's role, a traditional Japanese medicine role in Japan. Kampo is a unique adaptation of ancient Chinese medicine. It is covered by our national health insurance system. And about 90% of Japanese physicians, biomedicine-trained Japanese physicians use Kampo medicines in their daily practice. However, only less than 1% of Japanese physicians is specialist of Kampo medicines. So, yeah, I am kind of outlier of doing Kampo medicine, specializing Kampo medicine in Japan. And it is also widely available as over-the-counter drugs. I mean, the herbal preparations are available as over-the-counter drugs. So pharmacists also play a key role. And the situation for pharmacists is similar to that for physicians. So, there are no Kampo-only pharmacy schools in Japan. And even though they learn about medicinal plants in their standard curriculum, and Kampo is included in their national exams. But still, Kampo specialized pharmacists are very much small number in Japan, and training opportunity is kind of limited in Japan. So because both non-specialist doctors and pharmacists handle Kampo products, herbal products, and the diagnosis often depends on their very limited personal experience or limited anecdote. Furthermore, the number of Kampo specialists is gradually decreasing in Japan. So this situation highlights a strong need for standardization of practice and better educational tools in Japan. Therefore, our goal is to use AI and big data to translate this anecdote-based knowledge, specialists' anecdote-based knowledge into more objective, data-driven algorithms. That is easier for use to application by the non-specialist physicians or pharmacists. This is the key theme of my talk, from anecdote to algorithm. And this is the outline of my presentation. First, the background of Campo medicine, as I mentioned, and second, our method. Third, our result, and finally, my conclusion. So let's start with our methods. We have built a large-scale clinical database over more than 10 years, and actually 15 years. And the data comes from 6 representative Campo medicine centers across Japan, from the northern part of Japan to the south island of Japan, near Korean Peninsula. And this database includes patients' symptom questionnaires and diagnosis based on modern medicine, ICD-10 code, and the traditional patterns, ICD-11 code, and the Campo formulas that were prescribed by the specialist physicians. Next, our analytical approach. We applied machine learning to find the relationships between patients' symptoms and the diagnosis made by expert physicians, Campo expert physicians. And let me briefly explain the model we used. It's a type of machine learning called a random forest. You can imagine it as a collection of many simple, smaller decision trees, not one single huge one. And each tree makes a decision based on a patient's symptoms. And for example, a symptom sends the data down one path or another, like that. And at the end of the path is a diagnosis, such as A or B pattern diagnosis. And this single diagnosis counts as one vote by one small wood. And we use 500 of these trees, and they all vote. All 3 votes have one vote, and the final prediction is decided by the majority vote. A key strength of this model is that the symptoms at each branching point, named as node, are selected randomly. So this method is very robust and helps to prevent overfitting. We also used actually natural language processing. We used NLP to develop drug information systems. However, with the recent emergence of large language models like ChatGPT or Gemini, the landscape in this area has changed dramatically in this 1 or 2 weeks, or maybe in some months. So I will not go into detail on this specific topic today. Instead, I'd like to add one more thing about one future direction using these new technologies. Until now, we have focused on collecting data in a structured format for 15 years. But now we are exploring whether we can directly analyze the free text descriptions in electronic health records, as Dr. Shin explained in the morning lectures. Unlike in Korea, Japan does not have a nationally standardized format for electronic health records. Data formats differ between vendors, which has made it difficult to integrate data. However, we believe that LLMs have the potential to overcome this issue and help us integrate EHR data from multiple institutions all over Japan. Right, so next I will show you our results. Here are main results, and actually one of our results. And we developed prediction models for 3 fundamental Campo pattern diagnosis. They are deficiency excess, cold heat, and Qi stagnation from Qi blood fluid pattern diagnosis. As you can see, the prediction accuracy was not so bad, not quite good maybe, And for example, the accuracy for deficiency excess was about 81%, and for Qi stagnation, it was 96% in a selected patient group. Actually, for deficiency excess pattern and cold heat pattern, the accuracy could be over the 90% in selected populations, and around 80% accuracy is kind of real-world evaluation data. And these models can classify our patient's condition with high accuracy using only the reported symptoms without kind of physical examinations or lab data or things like that. And to give you a visual example, this figure shows the result for our Qi stagnation model. And excuse me, let me explain the figure. The vertical axis shows the probability of Qi stagnation predicted by our machine learning model. The top value 1.00 means 100% probability, or as I said, all 500 votes predicting Qi stagnation for this data or for this patient. The bottom is 0. The horizontal axis shows the patients sorted by their prediction value into two groups: those diagnosed with Qi stagnation and those who were not. Each dot represents a single patient from our test data. As you can see, the two groups are separated very cleanly. The patients who were actually diagnosed with Qi stagnation by specialist physicians, the top cluster, received very high prediction scores from our model. And in contrast, the patients without Qi stagnation, the bottom cluster, received very, very low scores. This demonstrates that our model can effectively distinguish between patients with and without this traditional pattern based on their symptoms. This table shows the top 10 most important questionnaire items that our model identified for making its predictions. I hope you can read the characters. And let's look at the cold heat pattern on the right. As you can see, subjective patient sensations like cold hypersensitivity in legs, cold intolerance, cold hypersensitivity in hands, general cold hypersensitivity, have a high importance. This is clinically very intuitive. I'd like to clarify that importance here in the table means, and the table is sorted by this value, the importance, and it's not a simple weight. And instead, importance is calculated by measuring how much the model's predictive performance will worsen if that specific item were removed from the model. The logic is completely different from that of linear regression models. And there are two critical takeaways from this. First, these items identified by the model are consistent with the diagnostic criteria for deficiency excess and cold heat patterns in the ICD-11 definitions. And this helps validate our model from a clinical perspective. And second, we searched for a biological, we searched a biological basis for these subjective feelings, especially for cold heat pattern. And we conducted a genome-wide association study on patients with and without hiesho, which is Japanese for cold temperature hypersensitivity. Our study identified multiple gene variants related to patients that are involved in the threshold of subjective temperature sensation. This is a key findings, and it suggests that there are objective genetic variants that supports the subjective patient's symptoms or informations, the patient's own feelings, which is a crucial part of traditional medical diagnosis. Based on our diagnostic models, we are developing a clinical application. A patient can input their symptoms using a tablet, and our system visualizes the patient's condition based on our prediction models. And this can help doctors, physicians, especially non-specialists, in their decision-making process. However, moving from diagnosis to predicting the final prescription is a much more challenging task for us right now. And the difficulty is that prescriptions are more often not exclusive to a single diagnosis. Furthermore, similar formulas create clusters, and interchangeable herbs result in a very high dimensional space for the data. So this makes it difficult to set a clear target for the prediction model. We are currently conducting an exploratory analysis to understand in which situations prediction works well and where it fails. By doing this, we are preparing to build a reliable prescription prediction model in the near future. We know that many researchers in Korea and China are pioneers in this area, so we are very eager to learn from your expertise. Right, so now I would like to move on to the conclusion. In conclusion, our AI-supported strategy does not replace physicians, but augments them with data-driven insights. This is very important for the many non-specialist physicians who use Kampo preparations in Japan. We also believe this approach has great potential as a global educational tool. It can help doctors, physicians trained in Western medicine to understand the complexities of East Asian medicine. Finally, our From Anecdote to Algorithm approach is a Japanese contribution to the global effort to modernize traditional medicine. We hope to continue this international dialogue and work together for a sustainable future for traditional medicine. So I would like to express my sincere gratitude to all my collaborators for this project. This work would not have been possible without the support of many people from Keio University, the University of Tokyo, and other great institutions. I also want to thank the funding agencies for their generous support. All right, thank you very much for your attention. 감사합니다. I'd be happy to answer any questions.
네, 고맙습니다. Thank you, Professor Yoshino. It was an inspiring lecture showing how AI and big data reshaping traditional Japanese medicine and the future of healthcare. 네, 그럼 계속해서 다음 세션 만나보겠습니다. 다음으로는 중의학 연구에서 인공지능 응용이라는 주제로 장레이 중국 중의학과
from China Academy of Chinese Medical Sciences on the topic of applications of artificial intelligence in traditional Chinese medicine research.
Good afternoon, fellow researchers. My name is Lei Zhang. I'm from Data Center of Traditional Chinese Medicine, China Academy of Chinese Medical Sciences. China Academy of Chinese Medical Sciences is a comprehensive research institution directly under the National Administration of TCM. It integrates scientific research, medical care, and education. Data Center of TCM was established in December 2014. It focused on the collection, management, and analysis of TCM, big data, as well as research in TCM data science and artificial intelligence. The title of my presentation is Application of Artificial Intelligence in Traditional Chinese Medicine Research. First, let me introduce myself. I got a bachelor degree in acupuncture and massage from Henan University at TCM. After that, I received a master's degree and a PhD from Shandong University at TCM. throughout my studies, I maintained a strong interest in computer science, and I wrote programs to conduct our data analysis for my graduation thesis. Following my PhD, I pursued postdoctoral research in computer science at Beijing Jiaotong University. My work has consistently focused on applying computational methods to resolve the problems of traditional Chinese medicine. This includes building databases, coding for data analysis, and designing algorithms tailored for TCM. With the advancement of artificial intelligence, I increasingly recognize the potential to significantly accelerating the development of TCM. My current research centered on AI application in TCM. There are 5 parts in my presentation. The first one is the application of AI in TCM. In terms of scientific research, AI can assist in uncovering more effective diagnostics and treatment patterns from vast amounts of clinical data, accelerating new drug discovery. In terms of clinical practice, AI-powered diagnostic devices, TCM, can objectively record and analyze unique information TCM, such as tongue and pulse diagnosis. AI can assist in suggesting diagnosis and treatment plans for doctors. As a result, it improves doctors' capabilities. In terms of healthcare management, AI can identify more cost-effective treatment strategies from a health and economic perspective. Applying artificial intelligence technology to build a smart hospital can help improve the efficiency of hospital diagnosis and treatment. The second part is the exploration of the law of diagnosis and treatment in TCM. The work began with the research and discovery of herbal formula composition rules. TCM prescriptions were rich repertories of clinical experience. The prescription was typically composed of a base formula and modifications based on specific symptoms. Effective methods are needed to fully extract this knowledge. Where frequent intermediate meaning is often used. Each result are highly sensitive to the minimum support threshold, yielding too many herbal combinations that obscure the core patterns. We proposed a minimal coverage-based compression method for frequent intermediates. This finds the smallest set of patterns covering all herbal combinations, providing a comprehensive yet concise representation of prescription rules. The left part of the slide shows the detail of the algorithm, and the right part shows the dataset of various hepatitis. The analysis results show key formula composition like 柴胡疏肝散 in the first line and 龙胆泻肝汤 in the second line, effectively reflecting prescription patterns. However, the result derived from this method still have many shortcomings. There are too many frequent item sets, and a considerable number of frequent item sets are quite similar. So, for the merging of these frequent item sets is required to obtain a more concise expression of the base formula and modification rules. The cluttering method includes 5 steps. 1. Calculate the dissimilarity between frequent item sets. 2. Select similar frequent item sets and combine them in pairs. 3. Cluttering based on combinations of similar frequent item sets. 4. Determine the base formula corresponding to each cluster. 5. Determine the drug modification corresponding to each item set. The result shows the base formula and modification rules within the dataset. We can see from a table. The first line shows the base formula. The third and fourth line show the addition and reduction of the herbs according to the base formula. The second and third row show the same base formula, which is the same to the last 4 rows. Finally, correlation analysis links base formula to specific symptoms and diagnosis, creating an intuitive symptom diagnosis prescription repetition. This is the result, and the diagnostic and therapeutic rules can be summarized based on the fundamental formula. Part 3 is about building AI-assisted prescription models. This is a key focus in TCM AI research. Conventional models exhibit limited efficacy, falling short of clinical utility. Their typical approach directly predicting which herb to use from symptoms contradicts the clinical reasoning process of TCM. The core TCM clinical reasoning follows a sequential logic. 1. Establishing disease and pattern diagnosis based on symptoms. 2. Determine therapeutic principles guided by the diagnosis. 3. Prescribing herbs align with the therapeutic principles. We developed a prescription recommendation model incorporating TCM diagnostic logic, enabling step-by-step intelligent syndrome differentiation, treatment principle determination, and prescription recommendation. This ensures the interpretability of the rules. This slide shows the key issue, key technology, and research finding of the work. This is the first AI-assisted diagnostic model closely aligning with real-world TCM clinical workflow, significantly enhancing clinical applicability of auxiliary diagnostic systems. This is another work addressing teachings where models ignore TCM molecular data and dosage. We created a model integrating TCM information with molecular representations. It simultaneously recommends prescription and predict precise herb dosage. The model outputs complete prescription outperforming general large language models like GPT 3.5. We construct an instruction tuning dataset by integrating real-world clinical records, classical medical tests, and TCM textbooks. Using large language model fine-tuning techniques, we implemented tasks like clinical decision support, disease syndrome identification, prescription recommendation, and TCM knowledge question and answers. Our AI assistant prescription model forms the core of the TCM clinical decision support system. It intelligently recommends herb formulas, classic medical cases, Chinese pattern medicines, and appropriate techniques, enhancing practitioner decision making. The fourth part is about TCM-based wellness model for addressing obesity issue. Obesity is a major global public health challenge, with rising rates, especially among the youth. Advances in AI, particularly large language models, are enabling smart, personalized obesity management and care. Models like ChatGPT show promise in nutrition advice, psychological support, exercise guidance, and education. They offer personalized plans based on individual needs. However, while ChatGPT's advice often aligns with guidance for simple chronic conditions, its accuracy drops significantly for complex multimorbidity cases, indicating a need for optimization. We are building a TCM wellness large language model focused on obesity, creating extensive datasets and fine-tuning specialized models to aid in managing obesity. Using guided consultation via large language models, we collect user data, including TCM-specific past information, to build a health profile. AI assesses health status and provides wellness or weight management advice through conversational interface. We are designing a multi-agent collaborative system based on TCM principles, defining agent roles and workflows for scalable, repetitive, intelligent diagnosis and treatment. This slide shows a guided diagnostic consultation intelligent agent. This slide shows a TCM knowledge question and answer agent. Finally, I introduced the joint laboratory for digital intelligence innovation in TCM applications. China Academy of Chinese Medical Sciences and China Unicom co-founded the Joint Laboratory for Digital Intelligence Innovation in TCM applications. We developed the TCM Digital Intelligence Research Platform, offering researchers one-stop, zero-code, low-barrier tools tailored for TCM. This platform establishes a new paradigm, build private dataset, rapid model training, generate research-specific AI agent. It holds a privately deployed full-capacity DeepSync foundation model, providing tools for model comparison and recommendation. These tools visually demonstrate model performance based on research needs, solving challenges like time-consuming configuration and suboptimal model selection. This concludes my presentation. Thank you for your attention. I welcome your valuable feedback. And you can attack me from the email.
네, 고맙습니다. Thank you, Dr. Zhang Lei, for your presentation and application of artificial intelligence in traditional Chinese medicine research. 네, 계속해서 다음
So let's move on to next section. The title is going to be Development Research on Auxiliary Technology Utilizing Artificial Intelligence for Organoleptic Test of Herbal Medicine, which will be delivered by Jong-hwan Kim from the Division of Herbal Medicine Research of National Institute of Food and Drug Safety Evaluation. Please give him a big round of applause to welcome him, everyone.
Hello everyone, I'm Jong-hwan Kim and I'm working at the Division of Herbal Medicine Research part in National Institute of Food and Drug Safety Evaluation. As you can see, the theme of this symposium, nowadays AI is a very hot issue all over the world. So one of the main research in my institute is to utilize AI into the national regulation. Well, before get started, I would like to introduce the history of AI technology for your understanding, because our research is in pursuit of XAI, not AI. That means you have to know the difference between the XAI and the AI. Let's get started. In 1970s, a computer program was created. Its aim was diagnosis and financial services. And then, however, this computer program has a characteristics. It's a rule-based. So this computer program is so-called an expert system. At this time, a few expert systems were created. The first is Elijah, simple decision-making tool to mimic psychiatrist. It was also the first chatbot all over the world. The second is Mycin. Mycin is a program to identify bacteria to treat blood infection. And then, as you can see, these expert system at early stage was related to human health. The last is LEX. LEX is a system that converts the inference process of an expert system into narrative form. In 1990s, more sophisticated models have emerged. As all of you might know, AlphaGo. It's a Baduk game AI program. The Google created AlphaGo in 2016 and input many kinds of how to win through the machine learning. However, nobody knows why and how AlphaGo made that decision to win the Isedol player. So AlphaGo was called the black box AI due to lack of transparency. In 2017, the US Defense Governmental Institute carried out a project to create glass box AI model to explain the inference process. So it was named XAI, or explainable AI, to ensure its of transparency. Since 2022, AI technology progress has begun to advance dramatically, and Sam Altman, CEO in OpenAI, released the first commercialized generative AI model. As I mentioned previously, AlphaGo belongs to black box AI model because the lack of transparency. On the contrast concept, there is a white box model. So all of you might guess it should be transparent. So XAI belongs to white box AI model. Then what category do the recently released AI model like ChatGPT, Llama, Gemini, including Kakao Eye, fall into white box or black box? These are categorized to black box AI. And XAI model has not been created so far. Previously mentioned the US Defense Government Institute, they just tried and completed their project without concrete XAI model. So we might have a question, why this black box or a model came out? According to some articles in the below, AI programmer make it on purpose or byproduct AI training. So in future, nobody knows. One of both AI model might merge the other one. Next is the aim of XAI implementation in national regulation. Korean Pharmacopoeia and Korean Herbal Pharmacopoeia have listed about 600 herbal medicine monographs, and considerable amount of herbal medicine has been imported from several countries like this. So annual import stat shows that about 14,000 ton and 2,800 imported case in Republic of Korea. So MFDS and NIFDS take in charge of quality control regulation in herbal medicine market. Some herbal medicines was reported as adulterated or misused species. Quality of herbal medicine consists of three processes. The first is organoleptic test, and second is physical-chemical test, and the last is the hazardous substance test. To regulate the quality control of herbal medicine, NIFDS, my institute, has published a guideline on this organoleptic test. This is a comprehensive test on species, appearance, color, smell, taste, and texture. Currently, 47 experts with extensive professional experience on this test are designated from academia and industry sector. This guideline explains the key point of organoleptic test and open to public through our national herbal medicine information website. Most explanation depends on naked eye, nose, tongue of experts. However, it needs to ensure the objective efficiency of organoleptic test, considering 2 points. One is decreasing the number of experts. The other one is this test is dependent on subjective and experiential intuition. The next is NIFDS XCI research. So my institute has begun this research. Its budget about $2 million for 5 years. The number of research items is about 500. Almost case was from the plant base. The research flow is a sampling from market and herbarium, and the sample selection based on organoleptic test. Main big data is image. That image may be including whole type or sliced type. And organoleptic test guideline published by my institute. Also, marker compound by HPH for taste and GC for smell, and DNA work for precise species might be included as option. These all data are going through deep learning for XAI model, and it shows decision with accuracy and explanation. This is Ziziphus seed. It's called Sanjoin from Ziziphus jujuba variety spinosa, listed in Korean Pharmacopoeia. 2 species below are known as a misused or adulterated species due to very similar appearance. XAI image visualization for deep learning on these samples is based on CNN, convolutionary neural network. CNN makes XAI recognize its color, line, shape, texture, and surface structure, and so on. And then also, jujuboside A is a marker compound for Ziziphus seed, and DNA work result with a species-specific primer is used as a data for XAI decision. And the last one is that to develop an image analytical instrument and its application. Currently, application is just prototype stage. And when we put a sample on the box, XAI is going to analyze its image and show the decision with explanation. So, if you ask a question, please let me know this sample Ziziphus seed is. So, XAI will respond. This sample is Ziziphus seed with 99.5% accuracy and its decision background. This is the current result as of July this year, and accuracy of most samples shows over 96. In case of Amomum species shows 97, Leum species show 98, Biscum species show 99, Uncaria species show 98, Artemisia species 99, Trichosanthes species 99, Epimedium species 96, Magnolia species 99, Tussilago species 99, Poria species 98, Hirudo species 98. Of course, some item with low accuracy not in this presentation need to be improved by further study. Next is the last part, it's a way forward. Our research is to keep studying on the list of item, and then for item with low accuracy, it will be improved by gathering extra samples and utilizing deep learning. And last two, if available, we are going to do sampling adulterated or misused species. And last one is to develop a practical implementation strategy for practitioner in charge of organoleptic test. Anyway, you might be expecting an amazing XAI model in the end of this research. And might be replacing current organoleptic test by experts, but I'm not sure because this is XAI, not human. Anyway, we are trying to develop a 100% trustworthy XAI model, hoping to make it closer to a perfect model. Thank you.
네, 고맙습니다. 김종환 연구관님께서 인공지능을 활용한
Yes, thank you very much. That was a presentation about the development research on auxiliary technology utilizing AI for organoleptic test of herbal medicine. Thank you very much for such a wonderful presentation.
연사분들로부터 의미 있는
So we had 4 presentations, very meaningful presentations. As you know, this symposium is attended by experts from around the world to highlight the value of traditional medicine and explore ways of technological collaboration. So our effort goes beyond the academic arena. It considers the wellness and health of the humankind. The academia, the industry, and relevant institutions and experts have compiled a lot of research results, so enabling us to hold this kind of event today. Through the presentations, we could see the balance between the past and present when it comes to traditional medicine, and also we saw future possibilities. So now, let us proceed with discussion. We will invite experts from around the world to share their insights about globalization of traditional medicine. The topics will include the use of AI and big data in innovating traditional medicine. The discussion was moderated by Dr. Shin Soo-young, who gave a special lecture in the morning from Kakao Healthcare. Please make sure you take a translation receiver when you come up, if necessary. And now let us welcome the speakers and Dr. Shin onto the stage. Professor Seo Byung-kwan, Professor Tetsuhiro Yoshino, Dr. Jang Lei, and Dr. Kim Jong-han, we welcome you to the stage.
예, 안녕하세요.
Good afternoon.
저장을 맡은 신수용.
I will be moderating this discussion. My name is Shin Soo-yong. I will be engaging in conversation with overseas speakers, so I will try and ask my questions in English to help.
Korean speakers can answer in Korean, and you guys to answer it in English, please. So, the first question is nowadays is a personalized medicine is a big trend, both in traditional medicine as well. So in traditional medicine, AI, how can AI help to establish or realize the personalized health care, starting from the professors?
네, 저는 그냥 한국말로 하겠습니다.
I'll speak in Korean. Personalized healthcare means to take into consideration of individual traits, like XAI and models of the predictive models. How we fine-tune those models will be a big issue. And I think you're all familiar with this issue, so I will ask Dr. Kim Jong-hwan regarding XAI model and how to raise the accuracy. Is there any other way? So in Korean medicine, are there any shortcomings when it comes to these models?
Yes, let me try to answer in Korean. So we call it XAI. We are putting a lot of research currently. So the most important big data would be image, such as color. So CNN is a methodology that we use and try to come up with data. However, when it comes to herbal medicine, it has a lot of different shapes and smells. They are very similar but slightly different, and that is why there is a lot of room for error or misjudgments, I believe. However, we try to target the standardized ones out in the market. We try to compile them. And with the images and shapes, we try to train the data. That is what we do. We put a lot of effort to minimize any kind of error. However, once again, it's not human, but it's trying to make the XAI recognize things. So when it comes to training the data, there can be a lot of different options. That's what I heard at first. We input a lot of different input or sources. But regarding whether the recognition was done well or not, we have to go through a lot of repetition. And as I mentioned in my presentation, regarding the ones with low accuracy, probably it's because they have different shapes or different species, although they have same shapes. So there may be quite a lot of errors. So we try to compile all the herbal medicine that have quite big possibility of errors in order to make improvements. So for example, when it comes to taste, we try to analyze a specific ingredient, and when it comes to smell, we try to utilize gastrography. And when it comes to very similar species, we try to input DNA outputs. And in that sense, we try to make sure that XAI has higher accuracy. That is the effort that we are trying to input. So the project will be completed in 2027. However, we are going to continue with the project with very similar characteristics, I believe, to make further improvements. So I think that can be the answer that I can provide for now. And regarding clinical aspects, I don't think I'm the person to answer the question, because regarding the quality of the herbal medicines that we treat with, we are more in charge of regulations. So I don't think I'm the one who can answer with the clinical aspects.
What's your opinion about how to realize the personalized using the AI?
Yes. So following
the professor's compositions, comments, and I would like to think about patient's world, and I mean, analyzing images and analyzing words would be kind of totally different world, and if we take patient's pictures, that should be, of course, 100% patient's pictures. But the patient would use another word in another situations and in another context. So, depends on the patient's clinical background or educational backgrounds. Patients may use different words, and like if we apply, let's say, generative AI, and that is totally depends on patient's word, and we have to be cautious about patient's background, and I mean, clinicians should be a good translator or interpreter of patient's personalized, backgrounded words. So this is my first point, and of course, another point, it should be kind of depends on Japanese situations. Thank you. As I said, in Japan, we have variety of herbal preparations, but non-specialists are kind of depends, selecting herbal preparations depends on the Western diagnosis to select herbal preparations. So we want to help non-specialist physicians or pharmacists to select appropriate, at least more personalized herbal preparations for them. And we are making kind of algorithms to help them to select an appropriate personalized herbal preparations, and we also want to validate that algorithm, and this may help us to validate the personalized medicine itself. I mean, we are not only validating the model that we made, but we are, in traditional medicine in Korea, China, and Japan, we are doing personalized medicine, but that should be validated in modern context, and that would be performed by using the AI-generated algorithms that should be reproducible, personalized medicine in the future, I think.
Traditional medicine is highly personalized. This reflects in two aspects: the uniqueness of each patient condition, which requires tailored treatment based on time, location, and individual characteristics, and the variation among practitioners. As traditional medicine is appearance-based, with each doctor having their own methods and often belonging to different schools, influenced by apprenticeship. AI can assist by providing customized diagnostic and treatment recommendations based on individuals' patient profiles. It should also be trained on data from different doctors or schools to account for variation in appearance and style. This is my opinion from the traditional Chinese medicine.
So at this time, let us change the point of view. So we need AI, but there's as I giving the lecture said, as I said, is we need data to implement the AI. So in the perspective of traditional medicine, so what kind of data is necessary to establish the traditional medicine AI for specific? So this time starting from the Dr. Kim, the count-wise, is Dr. Kim, you are first.
네, 사실 저희 평가원은
Well, actually, from my institute, when it comes to herbal medicine, we are carrying out quality control or quality assessment. So just like in other projects, quality standardization is something that we are trying quite a lot. And if possible, we try to divide based on the country of origin for herbal medicine and try to find out the characteristics based on those different countries of origin and try to reflect them in qualities. So yes, data, it's something that has no end. It's something limitless. But we try to make sure what aspects we need to fulfill in order to ensure the least or minimum level of quality. So regarding artificial intelligence, image data will be the one that we have highest demand for. And when it comes to research, we have to input everything. For example, A should be A, B should be B, and A is different from B. We have to input all those different individual information for the artificial intelligence. So it may seem something very easy, like an elementary school student, but anyway, if those data are accumulated on, the answer will be amazing. It's going to be a very wide range of standardized answers if you keep on that process. So when it comes to herbal medicine or regarding quality, those image data or the misused herbal medicine that are being reported from the field, I think the point is to secure as much as data on those fields. So let me try to ask a follow-up question. When you say image, are you talking about the image of herbal medicine, or are you talking about something else, just to clarify? So as I indicated on my presentation material, when I say image, it includes from color, the texture on the surface, whether it has a crack, whether it's split, whether it has any hole, color. So with the methodology CNN, we try to visualize them and put them into codes. That's what I'm talking about.
How about Dr. Zhang? What's your opinion about what kind of data do you necessary to implement the AI in TCM?
Yes, from a clinical perspective, we need a comprehensive treatment-related data. This includes symptoms, guiding diagnosis and treatment, personal information, modern medical health test result, diagnosis and treatment prescribed by doctors, and post-treatment outcomes. Only with complete data can AI effectively support clinical decision-making. Outcome data is particularly crucial. Without it, evaluating treatment efficacy and training optimal AI models becomes difficult. Unfortunately, such data is also missing in current clinical practice, and in the process of collecting clinical data in TCM, standardization work is also crucial.
So how about it's your turn, Professor Yoshino?
Thank you. So until now, we have focused on collecting structured data from specific formats in our data set, and especially from patients' questionnaires. However, we are now paying close attention to the potential to generative AI to process unstructured free text clinical notes in EMR. We want to start analyzing the vast amount of big data that already exists in these free text formats. Of course, this doesn't mean structured questionnaires are meaningless. They are extremely valuable for explicitly confirming the absence of a symptom. Knowing that a piece of information is missing is a critical data point.
예, 저 교수님.
네.
From a clinician's point of view, we need to consider the point of view of clinicians. As for personalized treatment, so why we treat this patient, when we determine this, we need the assistance from AI. Having said that, a weakness in Korean medicine is that to identify the root cause of the disease and symptoms, those are not accurately defined. So collecting data and materials should be assisted by AI also. So recently, there are research projects on biomarkers, finding biomarkers, but this is not so clear in the field of Korean medicine. So I came to think that this is something I might be afraid of the evaluation, diagnosis, and treatment data. We collected data and we find indication in a reverse direction. I think that is one of the purposes of using AI. The cold heat is something that we can approach easily, but the accuracy when it comes to cold heat is quite low as per the presentation before. So how to find it out itself is the very difficult question that lie ahead before us. So I look forward to receiving some technological assistance in that regard. And I have another question about standardization regarding Korean medicine. In Korean medicine, how do you approach standardization in the context of Korean medicine? It involves a little bit of strategy at KRCA. Within KRCDA and KRCO, there are these aspects. The Korean medicine data disclosing information in Korean data has faced a little bit of resistance, and there have been some difficulties. So I am not a person who established standards, but I am more about processing information. So I thought this information is not so burdensome. So common information among institutions, so it would be names and therapies and urban medicine covered by insurance. And that would belong to general information. So the association, so we talk to the academy and other associations for collaboration. So we are working stage by stage in a phased approach. For information, KRCDI is a notification of mandatory items that are standardized. The efforts have been going on for 3 years now.
So Dr. Zhang mentioned about the TCM LLM. It's quite interesting. So think about the AI can help a doctor, as a physician-patient communication matters because the Gen AI, so-called Gen AI, is really popular with the ChatGPT. Everybody think about the chatting interface is really popular using the current AI era. So, how AI can help the doctor-patient relationship, especially about between the medical decision-making process. So at this time, starting from the Professor Yoshino.
Sure. All right. So for physicians, as I mentioned, our research is centered on supporting non-specialists. So this focus brings a critical responsibility, and we must carefully consider the efficacy and safety of a system that could be used blindly, and we need to prevent a situation where a non-specialist simply prescribes what the AI suggests without their own clinical judgment. And this relates to the recent discussion around upskilling versus deskilling. So we want our AI to be a tool that educate and upskills doctors, physicians, not one that deskills them. And for patients, we are collaborating with a venture company on research and development, and their approach, unfortunately, this is not Kakao. I'm sorry about that, but the Japanese company, and their approach is to maintain regular contact with patients between their clinic visit. I mean, the patients may come my clinic 2 months ago and this month, and so there are 2 months between gap. I mean, the gap between the clinic visit and another next clinic visit. And they provide holistic advice that covers diet, maybe in traditional context, and exercise habits, and even clothing choices. And a key development goal is to use this continuous engagement to motivate patients, helping them adhere to their treatment plan and improve their overall lifestyle.
So how about Dr. Jing?
In terms of data collection, AI can help to gather objective information such as time and past indicators in traditional medicine. It can also generate electronic medical records from doctor-patient conversation using the large language models and reducing documentation burdens. During diagnosis and treatment, AI can offer recommendations and suggest follow-up questions or further examinations to prevent the oversight. Given the critical nature of healthcare, AI must provide the interpretable recommendation, underscoring the need for explainable AI technology.
김정은 연구관님.
So the question was about the patients, I believe. But for us, we don't have any direct contact with any patients. So I think I can give you some information about our limitations of our research. So let me talk about that part briefly. So I will focus on the available herbal medicines at the moment. So we try to train the data, and we also get impact from global warming or climate crisis. which means the images will be changing slightly, although they are coming from the exactly same species. And also, they used to be different shapes. However, although they are two different species, due to the climate changing, their locations, production locations are changing, and their shapes are changing, and they are recognized as two same things. So they are some of the challenges. However, we are continuing with our research, and with the designated research institute, we are trying to compile more samples. So in that sense, I think we need to secure further budget for a long-term research and image data, smell, or changes caused by specific ingredients. I think we need to make a broader review in that sense.
AI is not something everyone knows about. So regarding ChatGPT, if you think about it, AI needs the decision making between the doctor and patient. And if there is a gap, then the gap could be filled by AI. But if the patient already asked the question through AI, then the dynamic will be different. For medical practitioner, we talk about economic feasibility and evidence-based information. We always talk about providing evidence-based information to patient. So from a physician point of view, we need to reduce the possibility of accident. We need to be based on evidence. The accident occurs from the unknown. So in that regard, using ChatGPT or AI, I think that physicians, if they think that oh, this is something outside my expertise, so they are not very confident to deal with the case. For example, the patient information can be insufficient. So to fill the information gap faster, then we can use AI in those situations. And currently, we're working on CPG-based evidence collection to build a model, and it will be disclosed someday to the public. And using this, many projects will come out, I think. So these tools will contribute to reducing the gap in information, and that is the role that should be played by AI.
Just an interesting, funny question. It's a follow-up question of the final question. So you two are the medical doctors, not you are such a researcher. So I ask for the two doctors. So nowadays the patient ask for their symptoms to ChatGPT. They got the answers. They know the answers and bring their answers to the doctors, ask for the same questions, and compare the answers between the doctors and the human doctors and GPTs. What's your feelings about that?
기분이 나쁘죠. 네. 좀 전에 말씀드린 그 정도 격차.
So I just talked about gap in information. So I find it very regretful, particularly when the information is not correct, and when it is so directly related to their health status, and it also hampers the trust between doctors and patients. So we can utilize AI in reducing this issue as well. So I again emphasize reducing the gap in information.
I think this is not a new issue for physicians. As I am working in a kind of complementary alternative medicine clinic, and I am also internist. And from the internist point of view, actually, at least some of my patients were coming to me to discuss about anti-vaccinations or anti-steroidal topical cream for atopic dermatitis or things like that. So, I mean, anti-biomedical opinion in the patients. And so we have been working with the discussion over such situation for the patients. So recently some patients have been have done their discussion with ChatGPT or Gemini or something like that. But still, we are dealing with the kind of similar situations and correcting or adjusting patients' mind and discuss the patient's opinion and our evidence-based opinion. And we would like to make at least better decision for that specific context and for the specific patients. So so that will be continuous issue for the clinical situation, I think.
조금 더 드리고 싶었던 말씀이 한 가지 있어서.
One more thing I would add is regarding generative AI in medical arena. They collect information from particular specific institutions, a few institutions, so gaps are produced continuously. So you ask question about specific hospital situation. So I think we need separate training for patients when it comes to AI, use of AI to raise digital literacy. So the question itself is not accurate. So the answer is not accurate. So I talked to my doctors. I gave them medical record and I made them ask questions, and wrong questions led to wrong answers. So as AI is developing very fast, digital literacy should be raised urgently. I'm sure Kakao Healthcare will do its part for this. So what kind of information to collect is a huge issue for me.
Any other last comments do you give to the audience?
Yes. We're developing our AI, and many patients can use AI to provide them more suggestions, and they will talk about the suggestions with the doctor. And this, and the doctor must study more and to find the shortcoming of the AI and try to correct the mistake of AI and help the patient. And this provide the doctor further demand.
마지막으로 김정환 연구관님 뭔가 마지막으로 하고 싶은 말씀 있으시면.
네, 사실 저는 이제 인공지능 분야 전문가는 아니고요. 저는 이제
Frankly speaking, I'm not an expert in AI. I'm more on quality assessment, such as chemical analysis. So yes, AI is developing in a very fast speed. And for example, changes image to Ghibli style. It's causing a lot of interest from the public. We have quite a lot of application and technology among the public. However, regarding the general public, general consumers, they think that when it comes to AI, it's always perfect. It's always better than specialists or professional people. So a lot of people have this wrong concept. So we've been carrying out this project for the past 5 years, but even after the project is completed, I know that it's still going to lag behind in quite a lot of aspects. So we are going to put a lot of efforts to try to come up with the best output. However, I don't think we should have a blind trust on AI. So it's going to work only as a supplementary project for the government. However, we should put sufficient amount of time to make sure that whether we can fully utilize it, fully rely on it. So it's going to take quite a lot of time to validate it. So I kindly ask everyone to be patient and wait for its final result. So all four of you shared a lot of great comments. So I am currently working as a moderator, so I shouldn't be sharing my opinion, but do let me share my last opinion. So as the professors and researchers mentioned just before, AI is something that we can utilize only within the limit that we can use. So we shouldn't expect too much. We are very sure that AI is not going to disappear. So let's try to study and examine AI and fully prepare ourselves before utilizing it. So that's the end of the session. Thank you, everyone.
네, 고맙습니다.
Thank you very much for the discussion about the use of big data for innovating traditional medicine. Thank you for the in-depth discussion and insight into how to balance traditional medicine with new technologies. Let us give another round of applause to the moderator and the discussants. Now we're going to take a short break. We have prepared some refreshments in the lobby outside the venue, so please enjoy. So we're going to take a 20-minute break before we meet again at 3:40. Once again, all food and beverages except water is not allowed within the venue. We appreciate your cooperation. We'll see you back here at 3:40. Thank you.
Future of Korean medicine look like?
네, 많은 분들께서 이제 자리로 돌아오신 것 같아서 본격적으로 시작해 보도록 하겠습니다.
In the afternoon session with session 2. Before we begin, let me make a few housekeeping announcements. We'll be conducting a satisfaction level survey for this symposium, so please give us your feedback by participating in the survey so that we can improve the symposium even better for next year. Please scan the QR code at the back of the material, the proceedings, then you can participate in the satisfaction level survey. If you complete the survey, we will be giving out a little souvenir for you, so I look forward to your support and participation. And now let us begin session 2 about traditional medicine's standardization and global collaboration. We will have 3 presentations. The first presentation will be given by Professor Shan Wian-dong on the topic of the development and prospects of international standardization on traditional medicine. Professor Shan Wian-dong is a professor from Shanghai University and also chair of ISO TC 249.
Stage.
Thank you, Chairman. Good afternoon, dear experts and friends. First, I would like to express my sincere thanks to the NOKIO. They invited me to be here. And my presentation is about the development and prospect of the international standardization on the traditional medicine. My presentation contents, they included as follows 5 points. And the first point, I would like to briefly introduce the International Organization for Standardization. ISO is an independent, non-government organization. So ISO is called short for International Organization for Standardizations. So we can see ISO is a independent, non-government organizations. Actually, yes, NGO organizations. In ISO, established different special fields technical committee based on the different fields, which is responsible to develop international standards. So on this slide, we can see the organization structures. The ISO headquarters in Geneva. And we also came to see that currently there are about 130 the member bodies in the ISO. And there are over the 100 technical community in ISO. Just as I introduced the established different technical community and they're responsible to different area, the international standards. As I know, there are about 280 technical committee in ISO. Except technical committee, the second level is the SC, the separate committee. So totally, there are over the 800 technical committee, including TC and SC. Here is the ISO principle and the strategies. We can see there is the basic principle of ISO developed international standards. The first important market relevance. That's the meaning if you want to develop international standards,
these projects should be international market share, the market need. If these projects only the little space used only in the one country or two countries, it's not necessary to develop the international standard in ISO. That's meaning market relevance. And the second is also is a very important, the fundamental principle, consensus-based. If we want to propose a project, develop the international standard in ISO, there should be reached consensus. The first in the working group, and the second, the reach consensus in all of our member bodies. And there is very serious regulations for procedures on the development the standards. And the third point is voluntary. All the experts, all the member bodies, we working for the ISO, just contribution. There is no payment for expert for ISO job. And we also can see the ISO, the vision, mission, goal, and priorities. The major goal of international organizations and international standards, the major goal is promote the economic and the social development. And because today we are talking about how to promote the traditional medicine development, and we can see the scope of the ISO almost covered all the industry. Now we focus on the health and the traditional medicine. We can see ISO standards evolving in the field of the health, the industry, involve in medical equipment, the healthcare service, and the biotechnologies, and IT in the health fields, and the aging society. Also included the traditional medicine. The second point, I would like to briefly introduce some background of the ISO TC249. Just I say ISO established the technical community. They focus on the one fields, the special fields, the international standard in these fields. So ISO TC249 just focus development the traditional medicine international standards. So ISO TC249 was established in the 2009. At the beginning of TC249 established, the title reads Traditional Chinese Medicine, TCM, which focus on the developing international standards on the TCM. And the secretariat was allocated Shanghai University of Traditional Medicine. You know, following the 15 years of stable, the efficient development, the last year, ISO TMB, they approved a resolution. So after this resolution approved, they launched a global the voting for all of the member body of the ISO. So the result, the early of this year, the result they published. So approved the resolution, and ISO TC249, the expanding our scope and changed the title from the TCM to traditional medicine. So in response to the growing demand for the international standards in the fields, so currently there are two separate committees that were created. Just I introduced SC. This is the development the process point of the ISO TC 249. And we can see the last year, the scope expanding to cover all traditional medicine. And early of this year, approved the resolution of the ISO. So now we are finished the restructure, the changed organizations. The title changed to be traditional medicine. The secretariat of SC1, traditional Chinese medicine, also allocated to SAC in Shanghai, China. That's the copy to the new organizations to the SC1. And another SC2 is Ayurveda and Yoga was allocated to BIS. BIS is the standing body of India. So you can see this is the new, the ISO TC 249's scope. The scope, the different the TC have a different scope. You can see the scope, new scope is standardization of material, product, service, and process in the international medical system, including modern development of the systems, but not the clinic practice, just at this moment. Maybe in the future we will expanding and changed the scope. So our member bodies, totally we have 46. You can see divided P members or O members. P member and O member, they have a different right. You know, the O members just observer, and they can join the meeting, give a suggestion, share the information, but they do not have the right to vote. Here is the new TC 249 organization structures. So we can see there is a CAG, the Chairs Advice Group of the Governors. The Korea also are very important member bodies, and as also a CAG member, the members. And the new structure organizations, you can see the SC1 and SC2. I think in the future, maybe we'll establish the SC3, SC4, and others. This is the SC1, the traditional Chinese medicine, the school. So as the expert work for the TC 249, we know this is actually, this scope is our the original TC scope. Just now moved to the SC1, just for traditional Chinese medicine. I think in the future, maybe we will revise according to the development situation. It will be revised the scope. Maybe increase some area. Maybe revise some fields. And you know, there is a little bit different from the P member and O members because now we divide the member body for the TC level and the member bodies on the SC, the job. So on this slide, we also can find there are 6 the working group in the SC1. you can see the joint working group and working group 1, 2, 3, 4, 5, and the different the fields they are responsible for the different working group. This is about the Chair Advice Group, CAG. The CAG1 Chair Advice Group for Governance. They help to support the chairperson. They make decisions. They make the strategy or the working plan is very important. You can see Professor King. He is HOD, Head of Delegation of the Korea. They make the good experience for international standards, and also they made a great contribution to international standards. And the CAG2 consists of the convener from the working group, and we also can see the Choi Seung-mi is also our Korea, the expert friends, the colleagues, and also she is a very good experience and did a good job for the WG4. Here is liaison. What is the liaison? The liaison, something like as brother or sister organizations. So both the liaison, for example, WHO and IEC, both sides, we have equal rights. We have a right to join their meeting, and also we can propose a project to develop international standards. Both sides each other, we have equally. So totally, currently now we have 10 liaison organizations. These are our achievements. Up to now, we published 126 publications. You know, we, in the ISOTC, if we develop the international standards, we needed to spend 3 or 4 years. So this is a high efficiency, the international standards in TC 249. Except the published publication, we still have 68 IL standards under development. So these two numbers can show TC 249 is high efficiency because we published 123 international standards. The 68 issues we have a sustainable development because the under development. So we will change, always increase, maybe this week we disassemble 1, 2, 3, maybe next week 1 to 4 or the 1 to 5. That's increase and increase the number. And the good issues we can see 100% approved. This means in ISO, after the international standard published, after 5 years, they will evaluate the quality, good quality, and use in practice, and promote the international trend. You can see up to now we published the standards after 5 years about the 41 the standards. They are over the 5 years. Almost they are approved by ISO. So this is good quality. Here is the special information about, just like I introduced. Totally we have 6 working groups. The working group 1 is the quality and safety of raw materials. The group 2 is quality safety of the manufacturing products. And the working group 3 and acupuncture needles. The working group 4, quality safety medical devices and other acupuncture needles. So working group 4 did a very good job. It convened the decision making. Thank you very much. And working group 5, terminology and informatics. This scope of is very relevant with today's just we talk AI and big data. And join the working group 1. Just we established join the working group with the TC 215. That's the responsible to develop the international standards in the healthcare. They included the modernization healthcare system or included the traditional medicine. Here is this picture is about our preliminary meeting. Preliminary meeting is very important for the TC, every TC, because you know the important things we need to approve by the preliminary meetings, reach the consensus, and some issues after preliminary meetings we needed launch the CIB and the vote by all of our P members. So you can see this issue, you can see very active, the TC249, a lot of participants. They are about 200 to 600 participants joined our preliminary meeting. And third point, I would like to introduce successful cases and fulfilled ISO goal. Why we need to develop the international standards. So ISO standards, the goal, promote the economic and social development. So in the TC249, we have many successful cases. Here I just introduce one or two. You see, this is the case from the pharmaceutical company. And you can see they developed and proposed two herbal medicine. You see, this is the Latin name for the Conodium and Dendrum Bean. In Chinese, we call the Lingzi and the Shihu, the herbal medicine. You can see after this international standard published, you can see this is just a general common, the pharmaceutical company. But after this, they published, you can see the sales value, profit, the big increase. Now, this company, they become a public company. It's a good business. And side of the table, you can see not only this company, it is international standard promote the whole industry, the export, the good business. So this is a very successful, the cases for international standards, how to promote the economic development. Here is also has another cases for the medical devices. They also including the needles, the instruments for diagnostic instrument and whole decoction the machines. As ISO Secretariat, we also have a task the standard publicized and promotion. This is we can see our colleague, the Korea expert. They are very actively joined TC249, also make a big contributions. Here is our liaison visit WHO office and the Pharmacopoeia European and the Pharmacopoeia United States and a training program for developing countries. And the middle of the gentleman last year visited our office in Shanghai, the TC249 Secretariat. He's a General Secretary of ISO. When he visits the ISO Secretariat, I report the presentation, introduced TC249. And he heard that, he said, it would be great if the ISO old TC could be like us, TC249. It would be better. So I think it's pride for TC249's job. It's the basis on all of our experts. They try our best. And the 4 point, I would like to the personal consideration, the challenges and opportunities in the new situation. The challenges, I think, the currently unstable international situation, economic growth, low growth, and war. So I think these issues has a negative impact on the international organization. It's not only to the impact to the ISO, it's other, they are facing these same problems. The second is the status and the contribution of traditional medicine in global economic and social development need to be enhanced. This means, last evening I communication with Korea, the friends. We think we need to increase the traditional medicine contribution to the GMP. We needed to more contribution to the economic development and the social development. Then we can get the more support from the industry, the pharmaceutical industry, big company, and get from our government. And the third point, the international standardization of traditional medicine is facing with challenges of digital and intelligent transformation. Because, you know, there is a little bit different from the other industry. Traditional medicine is an ancient society. And we have traditional systems. Because the digitalizations or AI is modernization systems. So this is how to match the both sides. This is a little bit of challenge. So we needed to try our best. So this forum is very good that we can share the information both sides, the experts from different fields. Also, we have an opportunity. The first, I think, the aging society, again, the challenges of the human disease spectrum had led to an increasing demand for traditional medicine in the maintain the human health. I think in Korea, our experts and doctors, I believe that it's the same situation in Korea and China. In China, more and more patients, they are the first choice they want to see the traditional medicine doctors. I think this is the good opportunity. And the successful cases of international standard contribution to social and economic development, they provide more support from development of ISO TC249. Something like I take the example about some companies, they get a profit from the ISO. They increase their business, increase values. So now they are very actively to join the TC249. Some experts, they know this, the informations, they for us, they actively wanted to join the TC249 job. And the new standardization work model lead to human and assisted by AI will greatly enhance the efficiency and the quality of standardization work on the traditional medicine. How to use the emerging technologies integrated to the traditional medicine. This is our major topic today. I think it's also benefit for developing international standards in the field of traditional medicine. And finally, I would like to share the future, the perspectives. At first, I would like to, as a new TC 249, we will follow the strategy of ISO, and our working plannings also will follow priorities of ISO, something like this. And I also have three considerations would like to share our friends and experts. The first, as a TC249, we will maintain the stable and the efficient the development of ISO TC249 and share the international standardizations achievements that traditional medicine has made. And the second, strengthening international cooperation, widely listen to the demand of member bodies for international standardizations of traditional medicine, adhere to innovation and inclusive and the principle of ISO, and actively explore diverse mode of international standards for traditional medicine. All voice to be heard. This is the principle of ISO. And the third point is actively explore the combination of traditional medicine and emergent technologies such as digitalizations and AI on the international standard platform. That's we talking about today. It's a major topic. It's very useful for TC249 development. So I just briefly introduced the international standardization in the traditional medicine. The many thanks for the great contribution made by Korea delegation to ISO TC249. We looking forward to have more cooperation with the Nikon, all the different regions, the experts from Korea. Thank you.
Thank you, Dr. Byung-dong for the insightful presentation. 네, 계속해서 두 번째 진행자분을 소개해드리도록 하겠습니다.
Move on to the second presentation, which will be carried out by Mr. Kim Yong-seok, the professor of Kyungju University and head of delegate of ISO TC 249 Korea. The title will be Trends and Prospects of International Standardization of Korean Medicine, focusing on ISO TC 249. Please give him a big hand to welcome him.
Professor at Kyungju University. I currently serve as the head of Korean delegation of TC249 and co-chair of WHO Family International Classification. And it's a great honor to be here to share with you the trends and the prospect of international standardization of Korean medicine, focusing on the TC249. I'd like to thank the organizer to forgive me this valuable opportunity. My presentation will be structured in 4 parts. First, I will explain the need and the scope of standardization in Korean medicine. Second, I will review the Korean medicine international standard outcome and the standardization strategies. Third, I will introduce some of the major Korean national standard deliverables. And finally, I will discuss the future prospect and the direction. As you know, the traditional medicine market is growing rapidly. It projects to exceed 1.6 trillion US dollar for 2035 with an annual growth rate of more than 22%. With such rapid expansion, ensuring safety and reliability and the quality assurance become the essential. At the same time, international organizations such as the ISO, IEC, with the WHO were actively promoting standardization. Therefore, Korean medicine must also participate actively and strategically in this process. Let me now explain the range of standardization. As you can see, different organizations, international organizations play complementary roles. ISO set product standards to guarantee reliability and safety and quality assurance. And this also promotes global trade and consumer confidence. In contrast, the WHO focus more on the integrating traditional medicine into the mainstream healthcare and ensuring the responsible practice. In short, ISO addressed the what and how, while WHO emphasized the why and where. Together, we provide the comprehensive framework for advancing traditional medicine worldwide. The structure of ISO TC249, the SC1, as the professor, the chair of TC249, Shin Yan-dong, also introduced that one. And this group focused on the raw material manufacturing process and the acupuncture, the medical device and terminology. And we also work jointly with ISO TC215 on informatics. In addition, partnership with the WHO, OFAS, and WFCMS and IEC, ensuring broad international collaboration. As of August 2005, ISO TC249 SC1 has published the 126 ISO standard and the 69 currently under development. And Korea has played an active leadership role since 2011. A Korean expert had initiated 13 new proposals and published 28 standards and joined more than 20 collaborative projects with countries including China, Japan, and Canada. Korea has also hosted major international meeting that means to strengthen its global influence. And our strategy emphasizes the broad stakeholder engagement, bringing together academia and industry, government, and hospital. These strategies are guided by the national system and detail the technical roadmap. Importantly, 85% of the standard identified in our first roadmap was successfully published. That means the strategies, our first the roadmap and the strategies have to be highly effective. The development process involved in the several steps. First one is the discussion begun in the subcommittee levels. And the proposal are then reviewed by the Korean Media Committee. And after that, the FDA and the CAT, the coordinated with ISO TC249 for submission and voting. And this process ensures that all proposals are carefully evaluated and aligned with both national and international priorities. The Korean Institute of Oriental Medicine, so-called the KIOM, is play a central role. It acts as a hub coordinating activities across the sector. And its mission is to pioneer science and standardization. And its vision is to become the world-leading traditional medicine institute. By making standardization one of its core objectives, KIOM is helping to globalize the Korean medicine. And ISO follows a transparent and systemic pathway. First, new needs are identified through the survey, and then the subcommittee and the national bodies review the proposal. And finally, CATS submit then to the ISO for voting and approval. And process followed the annual schedule. In August, the survey are conducted. From September to November, proposal review and select. In January, new proposal are submit. In June, the ISO TC249 plenary meeting and working group meeting are held. And in July, follow-up action take place. This regular cycle ensured steady and predictable progress. The Korean Medicine International Standard Development Committee was established in 2010. It brings together about 20 experts in the Korean Media Committee and other 30 experts in the subcommittees. Their expertise covers the herbal medicine, terminology, and acupuncture and medical device, ensuring the balance across the field. From 2018 to 2024, the Korean implemented a strategic roadmap with 20 initiatives across the 4 domains. This roadmap provides structured progress and successfully aligned the national strategy with the international agendas. To ensure sustainability, we also place the great emphasis on the professional training. The training sessions are held at least twice a year, and the curriculum covers ISO directives and documentation, international meeting strategies, and trend analysis. Each year, around 50 the professionals are trained, securing a pool of future experts in the standardization. Next, let me highlight some deliverables. The process of harmonizing international ISO standard with the Korean national standards involves verification, stakeholder review, and the final approval by the advice committee coordinated by the Korean FDA and CATS. Through this process, we have achieved several notable outcomes. First is standard for the infection control in acupuncture, and the herbal decoction apparatus, and computerized tongue image system, and the safety standard for the cupping device. This result enhance both clinical practice and industrial application, contributing to the modernizing of the Korean medicine. Looking ahead, the Korean medicine is preparing for the digital and AI area by adopting new emerging technology to ensure safety and reliability. We are actively responding to the rise of digital therapeutics and align our framework with ISO and WHO standard to strengthen credibility and expand global recognition. Some of our key future initiatives include, the first one is standard for the herbal dispensary preparation, and DNA barcode-based genetic analysis for herbal medicine, and acupuncture electroceuticals. And finally, the category structure for disorder and patterns aligned with the WHO ICD-11. This initiative will not only ensure safety, but also enable innovation and deeper integration of traditional medicine into global health systems. In conclusion, the international standardization of Korean medicine through the ISO TC249 SC1 has laid an important foundation for enhancing its global recognition, safety, and quality assurance. Our achievement covered the herbal medicine, acupuncture, and medical device, terminology, and informatics. The prospects ahead are very promising. However, continued international collaboration will be essential. Therefore, through the standardization, we can preserve the unique identity of Korean medicine while also enhancing its global relevance. The international standards, the very important issues. And thank you very much for your attention. I look forward to your questions of the productive discussion. Thank you.
네, 고맙습니다. 김용석 교수님의 발표였는데요.
That was a presentation by Professor Kim Yong-seok, and he was emphasizing the necessity to promote a constant effort.
We have come to the final presentation of the session. Professor Kenny Kuhta from Georg August University, Göttingen, will give us a presentation on current status and prospects of standards for traditional medicine in Germany. Please welcome the speaker with a big hand.
Thank you very much for your kind invitation and for the opportunity to talk to you today about the current status and prospects of standards for traditional medicine in Germany. Now, I come from the other side of the globe, from Europe, and so when I talk about traditional medicine in Germany, we have to see that in Germany traditional medicine is always defined in contrast to what is called school medicine, or what also in East Asia is called often Western medicine. So before we can talk about traditional medicine in Germany, we must first see what is Western medicine, or what would one understand under Western medicine. Well, in a broad sense, Western medicine is all medicine that evolved from Western civilization, and in broad strokes, these medical schools of thought or traditions can be classified into three categories, at least as they are generally understood. So this is one of these categories is biochemical mechanistic medicine, or so-called school medicine. Sometimes it's a modern chemically defined medicine is established based on an a priori understanding of human biology and physiology, based on the scientific understanding of the human body that came after the Enlightenment. So this is what is often called modern medicine and scientific medicine. Also, the other is schools are alternative medicine. In Germany, there are two schools of alternative medicine that are legally acknowledged as medicine. These are homeopathy and anthroposophy. Homeopathy is based on the toxic substances shall cure in the ill person the same symptoms that they would cause when a healthy person takes a poison, and often then that is very diluted. And anthroposophy is a form of modernized alchemistic medicine from the Renaissance period that was modernized by an esoteric school of thought. So these are modern herbal medicines. Mostly these are herbal medicines based on an a priori philosophical speculation and worldview, mostly in opposition to the scientific school of the Enlightenment. And then we have one third category, and that is the important category of my lecture, namely phytotherapy. herbal medicine and traditional herbal medicine. So this includes traditional herbal medicines established by centuries of cultural evolution, so not pre-planned as the other two schools of thought, prior to the enlightenment of the last 2 centuries, that were a posteriori documented, and as also a school of scientific medicine, then a posteriori after their traditional development researched, but not developed newly based on research. Yes. So as you see in the German legal code, I have here a screenshot of the homepage of the German Office for the Registration of Medicines in the German Ministry of Health. There are 3 officially accepted particular therapeutic systems. So these are the therapeutic systems that are distinct from mechanistic biomedicine, and these 3 schools of these 3 particular therapeutic systems in German law are homeopathy and anthroposophy, so the 2 systems of alternative medicine, and as a third, you see this, the last point very below, the phytotherapy form of medicine, so this is traditional medicine. So what does that mean about the standing of Eastern medicine in Germany and in all of Europe? This is basically the same in all of the EU. So Eastern medicine is due to the above described legal background. Oh, farther away? Okay. So based on this above described legal background, the German law and European law does not distinguish when it comes to traditional medicine between foreign traditions and domestic traditions. And Eastern medicine is not biochemical mechanistic medicine or so-called school medicine, because it is not, at least not down to the last molecule, completely scientifically understood, because in biomechanistic medicine you often only have one single compound, and there are hundreds of compounds in one plant and more than 10 plants in many of the traditional prescriptions. Eastern medicine can also not be alternative medicine because it does not rely on esoteric forces like homeopathy relies on miasma and the dilution of compounds past the Avogadro limit, and also anthroposophy has spiritual forces at work. But here we rely on the active ingredients of plants. So therefore Eastern medicine cannot be alternative medicine in German law. And so only phytotherapy, the 3rd category of the particular therapy systems, remains. And therefore it is impossible to understand the situation, both the legal and cultural situation of Eastern medicine in Europe and especially Germany, without first understanding the situation of traditional European herbal medicine, for which the law has been developed, as the law treats both European traditional medicine and Eastern traditional medicine as essentially the same thing. Yes, so just like Eastern medicine developed from the Han Dynasty in China and then spread to the later Chinese dynasties and present China, and also to Korea and Japan, in Europe there is old traditional knowledge, papyri that were found in Egypt, the ancient Greek writings of Hippocrates, and also cuneiform writings from the Middle East and Mesopotamia. But basically the starting point of all current traditions of medicine in Europe is the Roman Empire, and the Roman Empire produced essentially the Western versions of the Shengnong Benkao Jing and of the Huandi Neijing. These would be in the West, the Materia Medica, written by the gentleman that you see in the painting on the top, Pedanius Dioscurides. He was a Greek person who lived in the 1st century AD in the Roman Empire, and he traveled as a doctor of the Roman army all of the empire and wrote down all the medicinal plants and their uses that he could find. And he produced a very big book, the Materia Medica, You have a page here from edition from the early 6th century AD, handwritten and hand-painted book, and this book of Pedanius Dioscurides contains hundreds of herbs that he described with their uses. And the gentleman here below, Claudius Galenus, was a Roman doctor from Rome. He was an active physician. He treated the gladiators in the Roman Colosseum, and he wrote a big book on his collected works on the internal workings on the bodies and which medicines to use after which diagnosis. And so these two are essentially the Western equivalents to the Shenong Beng Kaojing and to the Huangdi Neijing. And if you see here, they are even relatively similar in their contents. What you see here is a theory of temperaments from the work of Claudius Galenus, his universal scheme of bodily conditions and medical activities. He has the 4 classical elements: air, fire, earth, the bodily fluids, blood, yellow bile, black bile, and the slime in the lung. And he has colors and the tastes of foods and the taste of herbs that he associates with the elements and with the organs, and they are also associated to the life cycle of the earth, to spring, autumn, summer, the 4 seasons, the 4 stages of the life of the human beings, different kinds of feather and temperature, and male and female. And so everything is connected in the thoughts of Galenus, and so herbs and diagnosis are connected in these systems. And perhaps you have heard of choleric people, of melancholic people. Well, in the ancient Roman faith, in the Roman religion, the Romans believed that the soul goes through reincarnations and finds in reincarnation a body that fits to the character of the soul based on the composition of the body in the elements. And so a soul in which the feelings and emotions are fast and strong is dominated by yellow bile, so by the fire element, and that gives a choleric person, choleric, right? And melancholic is a person with slow emotions but strong emotions, so this is a person with black bile dominated by the earth element. And so even this is the traditional Roman view on psychology, and all this both for mental health and physical health. And these books were copied in the monasteries after the fall of the Roman Empire. The Catholic Church took it up on itself. Book printing was not yet invented, and the monks and nuns, they had to copy and did copy all the books of Galenus and the books of Dioscurides by hand for 1,000 years. But after 1,000 years, a new development was initiated by the woman whom you see on the very left. This is Saint Hildegard of Bingen. She founded the monastery of Bingen. You have the photo of the monastery of Bingen on the Rhine River in Germany. And she essentially is the German equivalent. She wrote the German equivalent to the Han Yakujin Seongbang. She copied the Dioscurides works, but then she saw that in the cold north of Europe there are many plants that the Romans did not know yet, and so she started to write new plants of northern Europe in the style of Dioscurides, and so medicine spread throughout northern Europe. And she also was a famous painter, author. She developed an artificial language, was a philosopher, and is today a saint in the Roman Catholic Church. And here you see one of her paintings from a medicine book, the human being within the elements, right, with air, fire, water, earth, and the holy light of God on the outside. Yes. Then I make another 700 years jump to this gentleman, Sebastian Kneipp. He was also the abbot of a monastery in Wörishofen, and he is very famous as a teacher of traditional medicine, and he lived in a time in the very late 19th century where already modern medicine science emerged, and there was much critique against the traditional medicine in Germany to expel traditional medicine from medicinal thought, and he led the political fight to keep traditional medicine as legal medicine in Germany. And he has in his philosophy and his books, the 5 columns of health, that the health of the human being rests on these 5 columns. They are in German, but I gave you translation. So good food, a meaningful life. For him, this was prayer in his monastery, but you have to believe that your life has meaning. If you see no meaning in your life will vanish. And the central column is the herbs, the herbal medicine. And then you have to use your body. You don't use it, you lose it. So mobility and use of the body. And the final column is water, good bathing, clean water, and many bathing to keep the body in equilibrium with the water and healthy. So this is the school of Sebastian Kneipp. Germany, in the times of Kneipp, you see here Otto von Bismarck. He lived in the same age as Kneipp, and Germany developed in this time the first welfare state with the law passed in 1883 that established the first public health insurance, in which the worker had to pay 2/3 of all medical bills, but the employer, the company that employed the worker, had to give 1/3, and this was given in a national insurance company that reimburses the patients for the drugs that they buy. And in this time, there was no difference between the different kind of medicine. All medicines that came from the apothecary were paid in this system. But there were also, of course, medicines that needed a prescription because they were too dangerous. But in this time, everything was paid. And today, this system has ballooned to 24.48 billion euros in 2023, within the German national budget of 476.29 billion euros. But there was a relatively unfortunate development 22 years ago, because there was the GKV-Modernisierungsgesetz, the Health Insurance Update Law, under which in order to save money, only drugs that needed legally a prescription were now paid. And drugs that didn't need a prescription and that you also are allowed as OTC were no longer paid by this insurance. So this was, especially for many poor people, a problem who could now no longer afford the traditional medicine because they have much fewer side effects, therefore didn't need a prescription and therefore were no longer paid. And rich people often do not buy so much medicine. And so many of the traditional family companies that make traditional German medicine got into economic problems because it wasn't paid anymore. And it is important to note that this dropping of traditional medicine from the health insurance was not a critique on its efficacy, but was only done in order to save money for the national health insurance, which, by the way, didn't work because now many poor people had to buy chemically defined drugs that have more side effects, and then they have to buy more drugs in order to treat the side effects of those drugs, and it became even more expensive. Yes. But some phytotherapy, some traditional medicine is still covered. So if there is an official indication indicated within the package of the drug that it is for an indication for children, then for children it is paid. Also in some cases where there is no chemically defined drug alternative, the traditional medicine is paid. This is most important with St. John's wort for light and even middle stage clinical depression. So Hypericum perforatum, this plant has in all clinical studies outperformed all chemical medicines when it came to treating clinical depression. And therefore it is accepted as the standard therapy for depression by the German Psychological Association. And as it is a standard therapy and there is no chemically defined alternative of same quality, this is always paid by the National Health Insurance. And in some cases, where due to specific cases there's no alternative, Viscum album mistletoe, this is an anthroposophic medicine for adjuvant tumor therapy, Indian plantain, plantago or ovata, and ginkgo for Alzheimer, dementia patients are also paid. Additionally to this, every physician in Germany has a contingent of 50 euros. It's unfortunately not much, but at least it's 50 euros per person per year that he can freely use to finance OTC medicine. So this includes also traditional medicine. In Austria, by the way, it's only slightly better than in Germany. They pay a bit more, but it's broadly similar. In Switzerland, traditional medicine is officially protected by the Constitution of Switzerland. So in Switzerland, basically everything is covered by the health insurance, and the Swiss are very strong in protecting traditional medicine. And as Switzerland also speaks German, is next to Germany, it's essentially the same traditional medicine as the German traditional medicine. Yes, so I will shortly introduce these most important traditional herbal medicines. So this I already mentioned, antidepressant Hypericum perforatum. It's by the German Society for Psychiatry. It's in the S3. It is the highest clinical guideline in the guidelines for treating unipolar depression, and it lists St. George's Wort as a standard treatment for both light and even medium stage clinical depression. And therefore, the mechanism is not known. It's a very complex extract of this plant, Hypericum perforatum, very well researched with hundreds chemical components known, but it seems to be the synergistic effect of many of these different chemical components of this plant that is active on the human neurocortex to treat clinical depression in light and intermediate stage. Then, this is, I said, not traditional medicine, so this is not phytotherapy in the law, this is alternative medicine, anthroposophic medicine. This is, so the alchemistic medicine, this is based on a philosophical sort, the law of similarities, that the mistletoe grows in the tree, similar like cancer grows in the human, and therefore it is thought of to be cancer therapy. Well, it has not unclear effects if cancer patients live longer, but it has very much quality of life effects. They do not suffer so much, and this is clinically accepted. And in palliative oncology treatment for patients for whom there is no hope for long-term survival, this is accepted. But in some cases, it may even prolong survival. It's not quite clear, but it improves quality of life, and therefore sometimes this is paid to cancer patients. Then we have Plantago ovata. These are flea seeds. This is the seeds of this plant on the right, Plantago ovata, and this, it regulates the bowel movement, it cures diarrhea, but it also works as a laxative in patients with constipation. It's very effective, often used also in our university clinic. And in patients with Crohn's disease or with short bowel syndrome, this is covered by the health insurance, and you see two of these products there. In the one you can see the seeds that I have been shredded there on the right. So this is a drug, this suspends this in water, and this gives a very slimy drink that is very effective both for diarrhea and constipation. And this is also, you know, this is an East Asian plant. It was brought to Europe by the Dutch from Nagasaki in Japan, where they took seeds in the early 18th century. And this is in Germany a specialized extract of ginkgo leaves, has official medical status in Germany, and it's also very effective to treat the progress and prevent the progress of dementia and Alzheimer's disease, and so in old patients in gerontology to keep the brain active, and especially the microcirculation. It enhances the microcirculation, and thus it treats cerebrovascular dementia, and in Alzheimer patients, this is therefore also sometimes covered by the insurance. Here, a short overview of the public awareness of phytotherapy in Germany. So these are a bit older data from 2020, but on the left you see that the data on the left are from 2010, but you see 70% of Germans regularly or at least sometimes take traditional medicine, and 30% don't, and in the 30% it's only 7% who say they reject the particular therapy systems ideologically. almost everyone is on board with their existence. And in 1970, it was only 52% of Germans that took traditional medicine. So in the last 50 years, and today I think it's even more, this has expanded much. And on the right, you see Germany is a cold country in the north of Europe, and 18% is cough medicine, and 16% of the, so this is what German traditional medicine is sold for in the pharmacies, a statistic from 5 years ago. 18% is cough medicine, 16% other respiratory diseases, and other than influenza and the common cold, which is another 8%, so much on the lung. But we have also 11% for stomach ulcer, 8% for men's problems and urologica, sedatives and sleeping pills based on traditional medicine with hops and with passion fruit leaves is 7%, muscle pain and blood circulation, laxatives, I just had the laxative, 3%, and others. So this is a broad overview over our, and it's millions of packages sold, yes. Yes, I already mentioned the clinical guidelines with the St. John's wort, and in the last few years, the AWMF, this is the Association of Working Group of Scientific Medical Societies. They make the clinical guidelines, and the medical guidelines have been advised for the WHO that there are to be guidelines to guide professional use of medicines. And I'm also in the scientific board of the Gesellschaft für Phytotherapie, the Society for Phytotherapy, Society for Herbal and Traditional Medicine in Germany. And this society, I have the mark here, is also a member in the AWMF member, and therefore contributes to the development of clinical guidelines, and therefore in the past years, over the past decades, traditional medicine and herbal medicine could be included in the medical guidelines. 1 decade ago, this was not the case. There was no traditional medicine in the clinical guidelines, but in the past 10 years, we have included in Germany much traditional medicine, also in clinical guidelines. So this situation is gradually improving. Yes, and Professor Kim and Professor Shen have already introduced you to the ISO TC 249. And as Germany uses much traditional medicine and also now Eastern medicine, that, as I mentioned, has the same status as a German traditional medicine, we actively take part in the ISO standards to look for the quality. Now, can there be a journey to the West for Eastern medicine? In Europe, with the EU, there are 3 types of application: full application, bibliography application, and traditional application. The first 2 are very expensive and very complicated, but with the traditional application, this is where traditional medicine is strong. Much of German traditional medicine is under this, and Eastern medicine, this is an open gate for Eastern medicine to make a journey to the West. In order to get this traditional registration, you have to show that your medicine is used worldwide for 30 years, 15 years in the EU. So when a book is published that mentions this in German, then 15 years after publishing this is established, or if you have affidavits from doctors who use it. Data from clinical studies are not necessary. You only have to show safety, positive benefit risk management, but there are limitations. So no life-threatening diseases can be in this indication. And it's a limited time of use, and you do not need a physician. So this is always OTC. But of course, as I mentioned, 50 euros per year a physician can prescribe, and physician can recommend anything even if it is not covered by the insurance. Yes, and so this is one of the medicines from Korea that has made its way to Germany for the treatment of gerontology and fatigue. Korean red ginseng, but this is dangbang, right? This is a single herb traditional Korean product. But what is about prescriptions? Well, big Asian prescriptions, unfortunately up to now only one single Asian traditional prescriptions. Yukgunjatang is this ready-made pills that are in Germany, and you see this is a joint venture of the Japanese company Ominedo and it's not advertising, but this is the only product that is a traditional East Asian prescriptions. In Japanese, it is Rikunchito, but it's the same as Yukunjatang here in Korea. And this is in every German pharmacy. You can buy this, and it has the indication for a traditional product for gastrointestinal complaints, loss of appetite, indisposition, bloating, and flatulence. And for this, it's available in every German pharmacy, and I hope with more use in single prescriptions by doctors of East Asian medicines in Germany, more traditional medicines will find their way in this way onto the German market. But as you see, one indication of Yukunjatang here in Korea or of Rikunchito in Japan is Cachexia patients in tumor therapy are often treated with this in Japan, and this is illegal to write on the package because patients can die from cachexia, and under this traditional license, you cannot write a deadly disease there, and therefore cachexia could not be written there. Also, it's very good for this and has from Japanese clinical research much evidence, but this is not possible in this license. Yes, but there is another way for traditional East Asian medicine to find its way on the German market, and this is in-house manufacture in pharmacies. Under German pharmacy law, every pharmacist in Germany who operates a pharmacy is able to make his own medicine and to sell it either at the request of a patient or as a prescription of a doctor, and up to 100 packages can be made in a pharmacy per day under this law that do not need any registration as long as the quality of the drugs from which they are made are guaranteed, and all of this is official medicine under the German Medicine Act. And this allows German pharmacists, and I made my doctorate in pharmacy, so this is a legal authority of German pharmacists, and this makes us in Germany very flexible because, for example, in the COVID-19 pandemic, it would not be possible to get all the 10 years that it would take to get a traditional medicine like the Yukunjatang through the registration process. But in China, there was this Chufeng Chidu Jiaoning, officially recommended by the Chinese Ministry of Health for the treatment of COVID-19. And so German pharmacy can make from compactates of the components that are in the Chinese original drugs that you see on the left. German pharmacists are in the authority to basically make a copy of this, and this was very useful in Germany to combat the COVID-19 pandemic that could be flexibly made by German pharmacists with this. And this is another way how East Asian medicine can find its way on the German market, and how also German traditional medicine can be flexibly preserved and continued into the future. Yes, these are the plants from which this medicine is made and the compactates, and I think I leave you with a beautiful picture of the plants, and thank you for your kind invitation, and it was a pleasure to give the Western traditional medicine perspective. Thank you very much.
Thank you, Professor Kaniguta. We have learned about both the present state and the future possibilities of traditional medicine standard in Germany. 네, 2025 전통의학 심포지엄 1일차.
So that was the very first day of 2025 International Symposium on Traditional Medicine. Thank you everyone for being with us today for such a long time. Tomorrow we will resume exactly at 10:30 with session number 3. We also have a survey for satisfaction on today's symposium. As mentioned earlier, we are conducting a survey on the satisfaction level of the attendees. So if you go on the very back of the booklet, you can see the access for the survey, and some of you can get a souvenir after completing your souvenir. And regarding the interpreting device, please make sure leave them on the desk.
네, 또 마지막으로
And lastly, we have a welcoming dinner for the distinguished guests. This dinner So after the symposium is over, our staff will guide you and bring you to the dinner venue.
Attending tonight's welcome dinner, please follow the guidance of our staff to move to the banquet hall. 네, 이것으로 2025 전통
So that will mark the end of the first day of 2025 ISTM. Thank you for being with us till the end of the session. I will see you tomorrow. Thank you very much.